good work in this conference. Thank you very much. Thank you, Professor Beici. Next, the floor to the head of Rare Association in Kosovo, Dr. Stipe Spahiu. Greetings to all. I wish you welcome. In the Cystic Fibrosis Conference, I won't stop to talk separately on names, but a specific thank to the Cystic Fibrosis European Association who believed and enabled us to hold this conference in Kosovo, respectively, in Pristina. Once again, thank you very much for your confidence. All to lecturers, I wish very good works and good works to the conference as well. Thank you very much. Thank you, Dr. Spahiu. Next, the Director of Pediatrician Clinic in the University Clinical Center of Kosovo, Dr. Violet Grajčevci-Uka, to greet this important event. Greetings, Honorable Minister of Health, Dr. Arben Vitia, Honorable Vice President of Chamber of Doctors of Kosovo, Dr. Ezard Halili, Honorable Professor, Head of Association of Pediatricians of Kosovo, Professor Ramush Beici, Honorable Dr. Stipe, Honorable participants of European Association on Cystic Fibrosis, doctors, nurses, specialists, honorable representatives of WHO, and all those who are participants in this event, who is very important for our country and at the same time for the pediatrician clinic. Let me congratulate welcome to this eminent pediatric conference focused on challenges and difficulties in diagnosing and treatment of this disease. It is a huge privilege to have among us experts of different field of activities, especially honorable professors from all around Europe, who with their lectures will enrich all innovations in regard to the management and treatment of this disease. Cystic fibrosis still remains a huge challenge for the medicine, affecting thousands of children in all around the world. However, thanks to ongoing improvements in health, new therapies, and multidisciplinary approach, made that this disease being managed properly, but we have still to do in regard to treatment and also diagnostification of this disease. I do hope that this conference will be not only an important step towards scientific and medicine progress, but a connection bridge with health professionals from different countries. Together, we might make the change and help our patients who want to live longer and with a lot of hope for better life quality. Thank you very much for your participation and have a nice day and useful conference and successful conference during today. Thank you very much. Thank you, Doctor. Today's joint meeting honored with his presence the Director of Pediatrician Clinic in Skopje, Mr. Recep Mehmeti, whom I do invite for a speech. Good afternoon.
Arben Vitia, respected professors, colleagues, dear patients and parents. As the director of the University Children's Clinic in Skopje, North Macedonia, I'm honored to attend the opening ceremony of this year's Eastern European Cystic Fibrosis Conference. Let me give you a brief info, some facts and figures about pediatric CF center in our clinic, where 110 children and adolescents are treated with the most modern therapy. Since 2018, at our clinic, all newborns are screened for CF as part of national newborn screening program. In the period 2023 and 2024, all patients 12 years of age and above eligible for treatment start with modulator therapy. Next month, as a next step, we are going to start with modulator therapy in children above 6 years. CF newborn screening, early diagnosis, early treatment, and multidisciplinary approach have led to better clinical stability, delaying complications, and significant extension of the life expectancy of patients with CF, but also leads to significant improvement in the quality of life and quality of life of their parents. And
finally, I just want to congratulate you to the host for this excellent organization and wish you all a successful conference and useful conference. Thank you very much for the opportunity. Thank you. Thank you, Dr. Mehmet. Let me invite for a speech Mr. Ade Rama, a representative of persons with cystic fibrosis in Kosovo Association. Mr. Ade. Finally, we are commencing this conference. We have done a huge work for about 6 months to have this conference as it is now happening. So thank you to all those who have supported us about organization of this conference. So also thank you to the Ministry of Health and who trusted us, this organization, and supported in all ways. So I do believe that this conference will be a returning point for our children. So I do also believe that now and onwards, dear Minister will have more challenges with us because we will be decided to bring new medicaments to Kosovo as soon as possible. So I do believe we'll have a good conference and meet experts of different countries. Thank you very much. Thank you very much, Mr. Rama. Pristina today unified prominent doctors from Albania, North Macedonia, Montenegro, on behalf of the host people for their support and thanks for participation. Let me invite on behalf of representatives from Albania the floor to Dr. Irena Hasmi. Good afternoon, honorable colleagues, representatives of Balkan countries, members of cystic fibrosis community, honorable partners. First of all, I do thank you from bottom of my heart for the opportunity provided to Albania to participate in this conference, where we are unified as a region to discuss the challenges and hopes, joint hopes in efforts of best standards of care for the cystic fibrosis community. Today, we are not simply representatives of our countries. We are spokesmen of hundreds of people who believe that these efforts might be the key for a healthy future where every children and adult with cystic fibrosis, either he, she in Tirana, Pristina, Podgorica or Skopje, have the same opportunities for better and full life. In the last decade, the care for cystic fibrosis encountered a revolution. The approach in new therapies with modulators has been expanded. Lives of patients have been transformed and number of adults, survivals and duration of life has been increased, a success that reminds us that life with cystic fibrosis might be full of hope. But on the other hand, global inequalities in the access on therapies and services remains an impediment. Today in Albania, we do confront another reality. We talking about specialized centers for children and or adults. The need for better standards of care updated, as well as an approach which is focused not on the duration of the life, but in the quality of the life as well. So I do thank you from my heart that with your commitment, you believed in the power that the cooperation has, and you also trusted that we might change in this way the life of people with cystic fibrosis. I do wish you a very successful works of this conference.
Thank you, Dr. Cosme. Under the name of the professionals and the doctors from Montenegro, I invite Mr. Tomor here for a speech. If the Montenegro representative is not present here, hoping that this conference, 12th conference will have a fruitful workshop for each of the professionals of this field, and allow me to thank you for you being here present. And let us just start with the panelist members and having their seats with exchanging their experiences in the panel here. Thank you once again. First panelists of the first session are actually Chris Smith, Hilde de Keyser, and Jacqueline Nordhoek.
Okay, so who starts? All right, good afternoon again. So let's begin. Several times the term twinning and twinning project was already mentioned at the opening ceremonial, at the address speeches. So let me now introduce twinning in a little bit more detail. As far as I know and remember, the idea of the twinning was born some 10, 12 years ago during the meeting of the experts who met in Verona and were there to create a series of papers on the standards of care and on the framework for CF care. This is the proof that I was there, but in the picture you can recognize other faces, and I would emphasize two of them. Jacqueline Nordhoek, who is the co-chair of this session. So Jacqueline was from the very beginning a big supporter of the idea to think of Eastern Europe and not to forget about this region. And Carlo Castellani, at the time the leader of the Standards of Care Working Group, was also a big supporter of the idea. And actually he, as a big visionary, said that the rules for the standards of care should be, of course, set according to the best practice, but at the same time, they should be achievable. And all the experts recognized at the time that this might be really difficult for some of European countries. And just let me read part from the paper saying that immediate implementation of these guidelines, meant to be guidelines for standards of care, may prove difficult for less economically advantaged countries where cystic fibrosis services are absent or inadequate. Were they right? So when we put some questionnaires and did surveys in Eastern Europe, so we actually proved that this is the case. The survey from 2015-2016 was about checking the situation in CF care in Eastern European countries. 16 countries participated in this questionnaire, in this survey, and just confirmed what we all perceived and felt. Only 12 countries out of those 16 could say that they had some sort of CF service and a presence of multidisciplinary team. But if you look at the roles of MDT members, many of them were missing, and I would just highlight one of them. CF nurse was present only in 8 countries out of 16. And in many countries, copied their concerns. They said, we have a lack of financial resources. We are not recognized by health authorities, and we have a huge lack of access to diagnostics and therapeutics. And the following survey in 2022 showed that there is definitely a concern in regards to the access to modern therapy. Some of Eastern European countries provided the data on the number of people on CFTR modulator therapy in May 2022. So when we focus only on the therapy with the most recent combination of modulators, elexacaftor, tezacaftor, ivacaftor, so we can see that just a minor portion of patients in those countries were treated by this best combination of modulators, despite the fact that in Europe, this drug was approved 2 years earlier, in August 2020. And 2 years later, you can see that many patients couldn't benefit from such a therapy. Another story, very successful one in Europe, and that's the European Cystic Fibrosis Society Clinical Trials Network, the network of CF sites who can run clinical trials and can be a synonym for centers of excellence. And you can see, this is the current map of CTN sites. There are altogether 68 from 20 countries. So you can see the underrepresentation of Eastern Europe. And let's remember one of the conclusions from the 2015 survey, that there is a need to support healthcare providers in Eastern Europe. So based on this, one of the CTN members, Professor Kors der Aan, sitting next to me in 2019, whispered the question, can we be of any help to the CF centers from Eastern Europe? And I, of course, replied, yes, of course. And this is how the twinning project was born. In 2020, ECFS, in collaboration with CF Europe, launched the twinning program. And the general idea was pretty easy. It was about collaboration and partnership between the two centers, one which we call mentor and the other which we call mentee. A mentor was supposed to coach, advise, support the mentee side. But it's not only one-way direction, it is mutual collaboration. There were specific needs, so when we asked the mentees what are their major issues, so you could see across the mentees, they were more or less the same. It was about the organization of the CF care in their centers. It was about some specific areas, like about microbiology, infection control, but also about the screening programs, about the national status genetic testing, and so on and so on. In December 2020, we started, and we recruited 8 mentors and 9 mentees, so they enrolled and they joined the program. Unfortunately, you remember 2020 was not the best time for traveling, and the key activity for twinning was actually the traveling to visit the site. Mentors were supposed to visit mentees. So in the meantime, they tried their best to get in contact through online meetings, emailing, and video conferences. But despite these troubles, the brave CF Europe and ECFS opened another call. In 2024, they opened the call for more mentees and mentors to apply. And actually, it was a huge success. 21 mentees applied and 19 mentors were there as well. So altogether, we ended up with 27 twinning partners. So you can imagine that 2024 was a very busy year for the coordinating center of the twinning program, but also, of course, for the participants. We started with the Zoom introductory meetings to explain what is twinning all about. We also created the opportunity to mentors and mentees to meet for the first time face-to-face during the Glasgow ECFS conference. And there are just 2 pictures, but there were many more. So example of the Bulgarian CF team meeting the Dutch CF team, or Israeli met Ukrainians. The people from the twinning program also attended a couple of autumn national CF conferences. We were invited to be at the Latvian CF conferences, and this gave us the opportunity also to talk to the authorities at those countries. So we visited the hospital and had a very fruitful discussion with the management of the hospital, but also with the MPs of the Latvian parliament. Southeastern European Conference took place in Cluj-Napoca in autumn 2024, and that was the huge opportunity for us, and I felt that it worked, actually, to network also the Romanian CF sites. So it wasn't only about the twinning side, which was Cluj-Napoca and Bucharest, but also the other sides could participate in that meeting and participate in the networking. Another CF conference in Poland, in Wieliczka, was dedicated, 1 full day was dedicated to the twinning. And this is another example of the collaboration and of the conferences where the twinning is and will be discussed. The coordination part of the program means that there are some people on behind it. And there we've got the project ambassador, and Katarina was already mentioned at the opening ceremonial. So project ambassador Katarina, the president of the Slovak CF Association and member of the CF Europe, is there actually to liaise between mentors and mentees, and we already found out this very useful. There is also additional benefit from the twinning from 2024, and that's not only the collaboration between the centers, but also between patient organizations of those countries. We've got another activity, and that's education activity. And thanks to the working group on education at the ECFS, thanks to Chris Smith and Helen Chadwick, we've got educational material translated into the languages of the twinning mentee sites. So it's completed now, the translation into Romanian, Ukrainian, and Turkish, but also to Albanian and into Latvian, Armenian, it's underway. But the most critical is, of course, the collaboration between mentors and mentees. And I personally love this picture because mentor-mentee collaboration is not only about partnership, but it's actually about friendship. And you can see that Elke with Chila became real friends. So how many visits took place during the twinning program? We started in 2021, 22 with very few then, of course, because of COVID times. 11 visited Bucharest, Southampton visited Athens, Brussels went to Cluj-Napoca. And last year, there were many more. Cambridge went to Skopje, Rotterdam to Sofia, Barcelona to Bratislava. But we actually had also the reciprocal visits. Mentees visited mentor sites, like Skopje went to Berlin. Venezia to Montpellier, very adventurous travel because they couldn't fly, so they used a couple of trains, to get to France. London was visited by Istanbul, and Leeds by both teams from Ankara, by pediatric and adult team. Both Estonian sides went to Cardiff, and Skopje went to Cambridge. Banská Bystrica to Manchester. So you can see that we made Flight Radar pretty busy last year. So in conclusion, what to say about the twinning? The twinning program has been there for 5 years now. We've got 27 twinning pairs, and most sites are pretty active. They made contacts and they visited each other. There is a twinning team, and the twinning team is there to support the mentor-mentee collaboration. We've got a travel budget, we've got educational materials, and we've got the assistants. A mentor team is there for mentees, of course, to help and maximally support. So let me say thank you to many initiatives across globe which help us, to make this twinning program working and live. And that's the CF Foundation, the American CF Foundation, and then working groups within the ECFS Society, like the European Patient Registry, Educational Platform, or the Clinical Trials Network. And I thank you very much for your attention.
Good afternoon again. While waiting for my presentation, I can already tell you this. If there's something I want you to remember from what I'm going to say over the next 10 minutes maybe, it is that it takes two sides to build a bridge. And in the twinning project, we're building quite some bridges. We're building bridges between mentor and mentee sites, mentor and mentee patient organizations, but we're also building a bridge between the professionals and the people with the lived experience, the experts in living with CF, the patients and their community, and the professional community. I was hoping my presentation would be here by now, but so Pavel already introduced you to the twinning project. It started indeed 12 years ago, and what changed for the last 2 years was that indeed CF Europe was able to contribute more to the twinning project than it was before, and that led to a much bigger group of twins, as you already saw in Pavel's presentation, but it also led to new activities and new collaborations in the sense of new ways of working together and bringing people together. There it is. So as I said, it takes two sides to build a bridge, and the twinning project is about improving access to high quality, multidisciplinary centered CF care and treatment through the sharing of knowledge, but also through networking, as Pavel rightly said so. CF Europe, that's us, the European Federation of Patient Organizations across Europe. And the twinning project is here in our strategy, strengthening the CF community across Europe, bringing people together to work towards a situation where people with CF can live their life to the fullest potential in society, having access to optimal collaborative care. CF Europe is a great believer, and I am a great believer in patient-driven healthcare and patient-driven policy work in healthcare. We moved in the past decades from being outside of the circle to the far right, I think, yeah, the far right, to being part of the circle. We want CF care to be collaborative and to be decided on together. And that's especially also what the twinning project does by working together, patients and the professional society together. You saw this side of the first twinning and of the second twinning project. And bringing in people with CF and their relatives and their organizations brings in a new layer of communication, a new way of identifying needs, identifying possible partners, and as you see, that was very successful in the second round of twins that we could make a year and a half ago. What exactly do patient organizations bring? As I said, it brings the possibility to really listen to what people with CF need, to what patient organizations need to live their lives and to do their work. It connects patient organizations to learning resources. So what Pavel said for professionals, CF Europe is also doing it for patient organizations and people with CF. There is a lot of information around. We want to unlock it and make it available to those who need it the most. We facilitate knowledge sharing and networking, and of course, advocacy and fundraising. Unmet needs for people with CF are clinical, obviously, but are also more than that, and that full picture is what we are looking at and what we try to address when working together with the different patient organizations across Europe. The patient organizations have been meeting, like the twinning partners in the CF centers, and have been working together. Latvia was in Paris visiting the French organization, and there will be people meeting here. People met in Cluj-Napoca last year. So this meeting, as Pavel said, is very important to grow, to learn from each other, to become friends and move forward together towards a better life for people with CF. This has been said. Facilitate knowledge sharing and networking opportunities, and that between CF centers, between patient organizations, but also between centers and patient organizations. So it becomes not only a bridge, but I don't know how to call it, but something that has 4 sides instead of 2, where everybody is around the same table and owns the discussion and the work towards better care. Because if I is replaced by we, even illness becomes wellness, and that's where we want to go. This is more technical. Because of time, I'm gonna skip that. Pavel talked about Katarina's work, the project ambassador visiting countries. So that was me. Thank you very much.
Well, good afternoon. I want to start by thanking the organisers for inviting me to speak today. This is a wonderful event, so I'm very honoured to be part of it, so thank you. So my name's Chris. I'm the current Director for Education for the European CF Society. In combination with my colleague Dr. Helen Chadwick, we help to support, run and coordinate the ECFS Education Project. And how the European Society can support your education in the future after this conference is over is the topic of my discussion today. And I've got 3 key messages for you. The first message is that we recognise the challenge that we all face when it comes to staying up to date with all the literature and all the guidelines that are published. And I want to just briefly revisit why this is a challenge and what the barriers are that we all face. The second key message I've got for you is that the education project from the ECFS is here to help you and is here to support us all. And I want to show you what the education project is, what resources are available and how you can access it. And the third key message I've got for you is that we do all learn differently and we do all require different forms of education. And I want to show you what the society is doing to try to understand the different education needs and what we're doing to try to action and meet those needs. So I want to start here with the challenge that we all face with staying up to date and current. And the best way to illustrate this is to use an international literature search engine like PubMed. Because if you type in the term cystic fibrosis into a search engine, and you search literature by year, what you get looks like this: a steadily increasing number of publications year on year. And in 2024, there were nearly 3,000 publications. So this is impossible for us all to read all these publications and to stay current with all this information. But the challenge doesn't just come from the number of publications. The challenge also comes from the increasing diversity within the condition of CF. So we're increasingly seeing new publications in emerging areas such as pregnancy and aging and heart health. And this can be illustrated very nicely looking at the most famous international textbook of cystic fibrosis, the Hawes and Geddes. This version, published only in 2006, had around 400 or so pages. But the most recent version of this textbook, published in 2023, has nearly an additional 300 pages, illustrating the increase in diversity and content of this condition. So the sheer number of publications and the sheer amount and scope of the work is one challenge that we all face in remaining up to date. But there are other challenges too. For example, we all have more patients to see and less time to do it. So time that we have available to educate ourselves is less. There is also the barrier of cost. International travel is more expensive. Attendance in international meetings is also more expensive, and this can limit our attendance at these meetings. And finally, we have the limitation of language. I know that if I have to read a paper in French, it will take me 2 or 3 times as long as it would do to read it in English. So these are all barriers that we face. But the education project is designed to help address some of these barriers. And I want to show you what the education project is doing. Because this project was set up in 2016 by Professor Peckham. And there were 4 key aims of this project. And one of these aims was to develop a web page and to develop a website that could collate the most recent research, the most recent resources to help all of the CF community learn in one place. And this profile can be achieved through Googling the European CF Society, and it takes you to this login page. You enter your username, you enter your password, and it takes you to this page here. And from this page here, there is an education section, which is here, and it takes you to this page here. And this is the starting point for the availability of hundreds of resources and information and data that you can access to support you. And I want to give you 4 examples that are available on this platform that you have access to. Because if you're a member of ECFS or you're a member of any of the twinning sites, access to this is completely free. So the first resource that's on here that I want to highlight to you is the e-learning project. This was developed over the last 5 or 6 years, and it's split into 3 parts. Each part is made up of between 8 to 20 modules, and each module is a 20-minute lecture on a specific area of cystic fibrosis by an international expert. And there is part 1, which is the foundation for cystic fibrosis, and part 2, which is for the expert area of CF. And these modules are all available on the platform to watch any time. Also on the platform, we have the syllabuses. The syllabuses have been developed over the last few years by the individual specialities within CF. So there is a syllabus for cystic fibrosis nurses, for physicians, for dietitians, for psychologists, for researchers. And these syllabuses list the key notions of education and knowledge that are required to deliver excellent practice. So these syllabuses can help identify any gaps in knowledge that can then be filled by the education platform. The third thing on the platform that's very useful is the recordings from the conferences. We've been recording conference material for the last 6 or 7 years. We've got recordings from Glasgow, from Rotterdam, from Vienna. So if you couldn't make it there to those meetings, you just have to make it here to the website, because all of the symposiums and satellite sessions are all available to watch in high definition as they would be if you were there. And we've expanded the lectures recorded that are available. So for example, we now have the ERS Adult Cystic Fibrosis Conference all available that was run in Milan, available to watch at any time. And finally, we collate some of the key articles and key guidelines all in one place. All the standards of care are all on the website, plus all of the abstracts and posters from the international conferences. So no longer does not attending the conference exclude you from the most up-to-date and the most emerging data. This is all available at any time. So hopefully you can see how the platform is helping to address some of the barriers that we face. There's no cost to this. There's no time restraint. It's all on demand. But the issue of language had up until recently remained a big barrier. But it is with the initiative and with the direction and care from the twinning team, from Pavel, from Hilda, from Katerina, and all of the team, that focus has come more on education support to be part of the twinning. And you'll now know that education, availability of the education to twinning sites is a key aim of the project, and also the translation of material. So over the last year, we've been translating education material using the EU recommendations. And as you heard, there's translations for Romanian, Ukrainian, Latvian, Turkish, Estonian. And now, thank you to Dr. Tashi, the Albanian conversions have all been completed, and these are all available. So there are memory sticks for each and every one of you today. So these with us, Helen and myself have a stand outside, and on these memory sticks are the first 6 modules of the e-learning project. There's no login, there's no password, there's no cost, and there's no language barrier. It's just high quality education to take away. I want to also just draw your attention quickly to the medication app. So this can be downloaded through iTunes and through the Apple Store. You log in with your ECFS login. There's information on all the common medications used in cystic fibrosis for both pediatrics and adults, listing doses, durations, recommendations, and advice. So hopefully you can see what we're doing to try to achieve additional support for all of our members. But I want to just realise that we do all learn differently, and the education that you may need may be very different from the education that you may need. So in 2023, we ran a very large international survey across the CF community, asking people what they wanted from education and how to support best. Nearly 550 people responded to this survey from nearly 60 countries, and we learned some very important information about how best to support education. We learned, for example, that the vast majority of us use online platforms, making the ECFS education platform very important. And we were also able to identify the priorities of the format for education that people wanted. So if we look internationally, articles are still the most demanded form of education from the community, followed by webinars and followed by accredited e-learning. But we can look at specific regions, and for example, it's possible to see within this region, webinars appear to be the most in-demand form of education. So I wanted to take the opportunity to let you know that the ECFS has doubled the number of webinars that we now do to try and meet this demand. And you can go onto the ECFS website, review all the webinars that we run. You can register for the new webinars. They're free. You don't need to be a member. They're fully accessible. And later on in the year, you'll be able to watch these with in real-time translation into your languages. And you can go back and watch previous webinars as well through the platform. And we also recognise that articles are particularly important as well for this region. So I want to say a big thank you to Dr. Kashimi, who has worked incredibly hard to help us translate the 4 standards of care papers, possibly some of the most important papers published in CF in the recent years. And these have been translated into Albanian and been cross-checked, and this is an excellent example as well of the teamwork that we've been able to do. So I'm very grateful, and all of these standards of care papers are also all uploaded onto the memory stick for you as well. So in conclusion, we do recognise the challenge that we all face staying up to date and the many barriers that we have. However, the education project and the education platform is here to support each and every one of our members, and we hope that you will use it as you see. And we do recognise that everybody does learn differently, that hopefully you can see how we're trying to understand best how people learn and try to meet those demands. So over the next 3 days, Helen and myself will be out here. So please do come and say hello. Please pick up your memory stick with all of the First Albanian Education package ready for you. No login, no password, no cost, no language barrier. Please come and meet us. We're very friendly and we want to understand more how we can support you in the future. Thank you very much.
Chris, thank you very much, for your talk. I'm now taking up the role of the moderator before the very last lecture. So I'll ask Jacqueline Nordweg for giving us the talk with the title Being a Parent of a Child with CF, How to Be an Impactful Patient Organization. So Jacqueline, please.
Thank you, Pavel. And thank you for having me here. I'm really very proud to be with you and especially to be the twinning partner of the Kosovo Patient Organization. And can you please raise your hand if you're involved with or working for a patient organization so I can estimate how many of you? Okay, raise your hands if you're working for a patient organization. Thank you. So, yes, the work for a patient organization, I'm around here for about 3 decades now. And there's so much that happened in that time when it comes to treatment and, a lot of things happened. Too much to say here. I just wanted to mention briefly, for the sake of time, I will shorten my presentation a little. Say something about the 5 pillars of the Dutch Patient Organization that is doing its work from the early 1960s already, and in around the year of 2000 it was professionalized with people working for the organization. So now we have 18 million inhabitants in the Netherlands, 1,750 do have cystic fibrosis. My organization has staffed 8 people, 2 on communication, education, 2 on fundraising, 2 on research and quality of care, 1 person for business administration, and myself. So, of course, advocacy, I think, is one of the earliest pillars when we talk about patient organization. It's about awareness to start with, but it also, nowadays, very important that we try to gain access for the innovative drugs for all people that are eligible but nevertheless cannot have it for what kind of reason. So advocacy in many ways for the whole population, for a group, but also for individuals who would turn towards our organization with questions of help when they, for example, are applying for a job. What do you say? Do you say, I have cystic fibrosis? Would that maybe scare the organization that you want to work for? Would it scare them off? So we have that kind of conversation. So it's advocacy in more ways. Then peer-to-peer contact. I remember the years that we came together with hundreds of parents and patients. Nowadays, that is not possible anymore. So what we do is we do organize tailor-made support, as we call it. Like we have this group of, say, 8 or 10 people that have very specific questions like, I have this and this age, I do not have access to the innovative drugs, what do I do? And we organize smaller online meetings to discuss this and to have them also give them the opportunity to exchange their own experiences and help each other out. Now, information and education, that's already been discussed a lot. I think your talk, Chris, really showed us not only how much information is available, but also how important it is. And I wanted to add to that also for the patient, it's very important to have access to that kind of information. So what we do, we have to make some sort of a, not only translation from English to the language that you're working in, but also to explain the information on a patient level And that can be very simplified. Nevertheless, it's very important that you do that. So through our website, through electronic newsletters, through what have you, we can make that kind of information, even high-level research and basic science, we can make that accessible for patients, and we do that a lot. So then we come to the fourth and the fifth pillars. In the Netherlands, the pillars of advocacy, peer-to-peer contact, and information is seen as the basic kind of work that you do when you are a patient organization. Yet we are developing into a more, let's say, that we want to be a center of expertise, not where we treat people, patients in a medical way, but where we can generate data that are so extremely important for people, not only for patients, but also for doctors. So when it comes to research, we do financially support research, but only the kind of research that's been prioritized by the patients themselves. So we go out and look for them and ask for their ideas through questionnaires. And we come to research programs that can take 5 years and cost about 5 to 10 million every 5 years, but it's really coming from the unmet needs of the patients. And then the CF registry, it's mentioned a couple of times already. We are, and that I think is quite exceptional for a patient organization, we do run and own the CF registry as a patient organization. And that's very exciting, actually. Years ago, it was a little bit difficult, to tell you the truth, because for CF centers, it's sometimes, having data is sensitive stuff. And when you want to, let's say, compare the outcomes of CF centers, that's sensitive because you are looking at each other's data. Nevertheless, we were able to overcome this sort of a problem, and it wasn't really a problem, but we could really see that what we were delivering in terms of data would help the center to improve their quality of care. And I just want to mention 2 examples. We have 7 CF centers in the Netherlands, both for adults and child's care. And it's been about a decade ago that we discovered, for example, the average lung function wasn't the same everywhere as what you would expect on the average. So we looked at the center that was having the highest average lung function and the one that had the lowest. We compared those data, and we invited the center to come and sit together and see what the difference were. They mentioned what the differences were. They implemented changes in their guidelines, and even in the Dutch general guidelines. And in the following years, we could see that from this specific center, the average lung function went up and up and up. And that, of course, is very important. And the same has been done with regard to the body mass index. And now we are focusing on diabetes, because that happens to be a little under-diagnosed in some centers. So we're diving into that kind of data and sharing that with the center. And in that way, I think we are more and more developing as a center of expertise. Benchmarking qualities I've already mentioned. Very exciting times. And my last slide, well, not really last, one slide to go after this one, is I wanted to take a brief route through how patient participation is organized and how it can be sustainable and effective. As a matter of fact, these criteria were developed by my own research. I defended my thesis, my PhD 2 years ago on these criteria. And on the left hand, the upper quarter, you can see that we do the, as I already explained, the inventory on the entire patient population to see what are the unmet needs. So it's prioritized, but then you want to guarantee also the scientific quality of your program. And that is why where the scientifically educated patients come in, but also we want to have every project reviewed by external scientific experts. And then we go to the yellow part to guarantee sustainability. Of course, you want to follow up on all the projects and how people are doing and what they are finding, what kind of results they are. So twice a year, we sit together with every project, every researcher in this group to see how they are moving forward. And sometimes they're not moving forward. That's not a problem. There's always a reason why, and we can then exchange information about what to do next. And of course, we do also, as I already mentioned, support the research not only by financial supporting it, but also with our registry, because very often we are asked for all kind of data sets, like people want to research something, have a project, need data about a certain specific cohort, and they can get, not always get it, sometimes pay for it when it's some stakeholder, have that data set. So that's also very helpful, I think, into doing research and doing the work as a center of expertise. So we're here now. I am here to cooperate with the Kosovo Patient Organization, and it just made me think over like what was helpful for me when we were developing all the work that we are doing now. And you know, the question is how impactful is it and how can we continue and how do we do it? The first thing that came into mind was start small, which is a little bit contradictory to what we want, because we want to make big steps and take things forward. Yet I do feel that start small, take your time, and do one thing at a time is very important. It was already mentioned a few times that we work with professionals and volunteers, and I've heard that sometimes, and so that's the same in my country, it's very hard to get volunteers working with you who are always devoted, but it's difficult to find the time to do the work because you have to do it next to your own work and caring very often for your own children who might have CF. Well, I'd say be inspiring and deliver. It's very important that as a patient organization, you can show that your work is really supportive to the center. You want to cooperate with the centers and deliver. What I mean with that is if you can show how important it is, what data will bring them forward, will help them to move forward, then you're the right stakeholder to work together with. Be the leader of your own process. Well, that's something I always have in mind. Always try to, define what's the next step, what do I want to achieve, and try to reach for that. And be a trustworthy stakeholder. We have doctors, we have professors, we have patient organizations, we have volunteers, and somehow we do manage to work together. And I want to conclude with this remark. I think, gatherings like these really are helpful in doing that and moving us to the next level. Thank you so much for your attention.
Jacqueline, thank you very much for summarizing the agenda of the Dutch CF Association and for inspirational points at the end of your presentation. For the sake of the time, I suggest to skip the discussion, but don't worry, I don't suggest to skip the coffee break. We will have a coffee break, 10 minutes, so which means that we will meet back here in quarter to 3. And Hilde, you want to add something? Okay.
So, yeah, I just wanted to add, Pavel, I totally agree. What I want to say is these People here are around, so please ask your questions to Jacqueline and to Chris over the coffee break or in the coming days. I'm sure this is going to be a very interesting session, and I hope people will continue to join us. We started. So, I'm going to invite the first speakers on stage, Vlora Nimani and Marit van Ooyerschoot. If you could please join us to talk about the twinning project where Pristina and Utrecht work together. Thank you.
Okay, so we have two microphones, it's okay. Thank you, Hilde. I will be presenting in Albanian, but I'm sure the translator will translate whatever I say. And then Marit can continue in English.
Yes, in English.
Okay.
Thank you very much, all. You are present. I don't know, we are bad with time, so we're trying to be as much as practical and short. Once again, I'm Dr. Vlora Nimani. I'm pediatrician, head of pulmonology section, ward in pediatry. Since last year, we are part of twinning project with a pediatrician clinic in Utrecht of Netherlands, with whom we found common language in regard to the discussion, patient management with cystic fibrosis. In this picture, I'm introducing only a small part of a big team who dealt with a long time with cystic fibrosis patients. A number of patients we have registered till now are about 149, 150 patients. It is a multidisciplinary, partial multidisciplinary team, not complete one. We of pulmonology ward, specialist of gastropathology warden who helps us with consultations, endocrinology, psychiatric is involved recently, and also nurses who plays a very important role in this part. Some data, curiosities. Kosovo is a small country in Southeast Europe, surrounded by neighbors Albania, North Macedonia, Serbia, and Montenegro. Pristina, capital city, is having 300,000 inhabitants approximately, and it is a place which interacts a lot of institutions, cultural diversities. It is a country of Assembly of Kosovo, National Library of Kosovo, then Kosovo Assembly. A current number of patients is 149. Pediatric clinic, you see it in a picture in the below part, has a capacity of 150 beds, out of which cystic fibrosis unit has 4 single bedrooms, means there are single bedrooms accommodating 4 patients at the same time are not sufficient. We are quite aware of that, but I do think that starting from this point, then we can expand our capacities. Our difficulties we do confront today and many times before were not enough rooms for patients with cystic fibrosis. We still don't have a sufficient completed multidisciplinary team in regard to the management of these patients. In our team, we have no nutritionists and physiotherapists who are two important part of managing patients with cystic fibrosis. We are still of the less few countries in Balkans and Southeast Europe who don't have modulators in disposal, which is one of very expensive therapy which changes the quality of patients with cystic fibrosis. And we do also need for more staff, we need all fields of activities, especially middle staff and more nurses to confront daily duties in regard to the patients with cystic fibrosis. Now, I do pass the floor to my colleague who will continue the presentation in English language for her part.
Okay, good afternoon. My name is Marit and I'm working on the University Medical Center in Utrecht in the Netherlands. And we are the mentor side, so I would like to thank the organization that we could come and to see you all here today. You can see on the slides On the red circle is the pediatric department of our hospital, and you see on the second circle you have the adults hospital, and we have at this moment we have 180 children with CF, and we have almost 300 adults, and we also have we also have 66 people after lung transplantation. We have a multidisciplinary team, and you can see it's not only the doctors, a specialized nurse, but also a dietist. We have here in the room our physiotherapists who are going to give a workshop tomorrow, so all come. But first of all, the Netherlands, maybe you don't know where it is. It's almost 24 hours by car. We took this morning at 4 o'clock a plane, so that's why we are here right now. But you see the Netherlands is over there and we are now over here. How do we organize the care in our hospital? I told you before, we have a multidisciplinary team. We work to the national consensus from 2018. I will explain later this afternoon more about the consensus, the European consensus. But we also have our own guidelines from our hospital. In the Netherlands, we have CF centers. Jacqueline told you already. Every center has a pediatric department and an adults department. We do newborn screening since 2011. We have IV home care. We have e-health. We are available for our patients and their family 24 hours a day. And also we have organized the CF care in the University Medical Center Utrecht. I'm sorry, because it's a different presentation than I thought I would have been. We have the Dutch CF Foundation, where Jacqueline was told you 30 minutes ago. We have the Dutch Registry. You can see the Dutch Registry on the right-hand side, because all the 7 CF centers in the Netherlands have to fill in every year a lot of questions, and on every patient they have to fill in this patient has Pseudomonas, this patient has an IV treatment, and how many IV treatment does the patient had this year, and so many questions. So the Dutch registry, our patients organization, will fill in from all the centers, and then we get a global registry, and this is the registry from 2023. So you can see in the Netherlands we have 1,656 patients, and you can see it were 551 children. So you can see how we are managing and are doing it in the Netherlands. We also have a very big CF research network. We are participating in the Dutch CF trial consortium, also in the international trial consortium, and we have a CF nursing network. So what do we have accomplished since we are beginning our twinning collaborations? Now we have regular Zoom meetings. We are discussing old and new cases. We are going to try to start online nurses, but I think it's also very good that we are standing here just next to each other today and the next few days. My colleague and I will go and visit on Monday the hospital, so I'm very curious how you are all working. And we have enough challenges to go, and now the first challenge you can see here was the Zoom meeting on regular basis, so we are going to try it do more often. We have a lot of objectives for 25 this year. Maybe in the next few days we're getting more and more, but I don't know. But we would like to visit the center this on Monday, and we are going to come back in October. So I heard in the wandelgang, I don't know how you spell it in English, we hope to train the nurses and doctors also on the nutrition and add it to the team. So, oh, this was the end. I'm so sorry. This is an abrupt einde. Thank you very much.
Thank you very much. So we heard that the twinning expansion project is not only about collaboration of the CF sites, but also of patient organizations. So we will carry on with the presentation from the patient organization perspective. So I will ask Adde Rama and Jacqueline Nordhoek to go forward and tell us about the twinning project, patient organization Republic of Kosovo and patient organization the Netherlands.
Okay, I will speak Albanian too, so
Greetings to everyone. From the Twinning Project, I believe that I am the luckiest person in Europe, actually, as my mentor is Miss Jacqueline, who actually has a very broad experience in this field, and for a very long time she was head of or president of the organization, European organization, for which I believe that I will receive a lot of knowledge and information, and our objectives in this project, I believe that we will reach them together. I'll start with a short presentation of our organization in Kosovo, which actually deals with represents cystic fibrosis people in Kosovo, which mission is to represent, the aim is to represent people with cystic fibrosis in Kosovo, to ensure that their rights are met and seek access to medications for these cystic patients. And its vision actually was always that all cystic fibrosis have an access, a better access in medications and equipment that are necessary for physio treatment. So our main aim was always, regarding the raising awareness, and we did it through culture and sports, which played a very big role indeed, and our society, actually, our community, in raising awareness of this disease. We wanted to express our will to have access on the module. In Kosovo, there are 145 people, or 149 people. 77 out of them are from men, and the rest are women. And we have 23 patients that that are adults. This is according to the ages listed here. This is actually a picture of our first meeting in the previous year with the representatives from the Netherlands, with doctors and the organization people, where we discussed our objectives, what we expect from this project, and I believe that the benefits will be, as big as their experiences in dealing with this disease. A twinning project objective is that we, as an organization, that all materials for patients will be taking them to Kosovo, and we translate them into Albanian in order to be in the function of or available to all family members of those affected by this disease. We will have other, conferences with the staff, and there will be visits between two countries, especially specialized doctors, especially from the Utrecht Hospital University in Kosovo. However, we will be facing challenges in this regard as well, having into account that in Kosovo there is a lack of new medications. We consider it to be challenging. So it will be challenging for us to receive or to have, information about them. Another challenge will also be health system in Kosovo, which should do a very good job in order for us to be at the same level with the Netherlands. I know that we will be having challenges. Regardless, we will manage to achieve our aims. And I believe that eventually, by the end of this project, we'll actually manage to create a new, more sophisticated platform in Kosovo with regard to the raising awareness, so raising awareness of the community regarding this disease. So we want to replicate a model as in the Netherlands in order to develop it in our country.
For your very important insights. You mentioned the numbers. Yes. The numbers tell us a lot, don't they? When I looked at the data, it is 1/3 of your population is adult. In the Netherlands, it's 2/3. 2/3. That makes me feel like, what? Somehow you feel a little bit like loneliness, powerless, but together we can make this journey. And then you mentioned the word awareness. Why is awareness, years ago when we talked about awareness, I thought, well, what is so important about awareness? If we all know what cystic fibrosis is, well, what have we gained by that? But, it really depends where you were born in order to get the best treatment that's out there. And what I feel is very important, and maybe we have did some work in that regard with the European Parliament, for example. We all know that if innovative medication is approved by EMA, the European Medicine Agency, we do know that's about efficacy and about safety, I think. And then when they approve, it goes to the European Commission and they are deciding on market access. And then every country decides on its own way, on its own criteria, how to deal. And it, of course, depends on the economic situation, healthcare situation, political situation, awareness situation. And that's a very difficult task and a difficult problem to solve. But I promise you, we will exchange. And I do not want to finish this short review with saying it's not only you learning from us, it's also we are learning from you. Thank you.
Thank you very much. And now we can continue with another country, with Albania, where we have another twin. It's adult center represented by Irma Tashi, and their partner, their mentor is from Italy, from Rome, Professor Fabio Maio.
Përshëndetje të gjitha. Atë prezantimi është në anglisht, por do bëj paraqitje në shqip.
So I'll do the presentation into Albanian for the participants as well, even though the slides are in English. So, first of all, it is an honor for me to be here of these excellent mentors from Bambino Gesù from Rome. Let me just say that we are at the beginning of establishing the adult center. So the Adult Cystic Fibrosis Center was planned to be established in 2022 as a need for the follow-up treatment of adult patients. So transferring of these patients is done in collaboration with the pediatric center by obtaining all the required or necessary documentation. And actually we have 23 registered patients, but only part of them are from a follow-up. So this is our team, the nurse and Sergio. We are, the first to establish this establishers of this department. The University of Lung Department, Regional Hospital of Tirana, and besides the pulmonology consults, we receive also endocrinological advisors, surgical, and as well we receive the support or assistance from screening and images, So after the age of 18, the patients are follow up at our center, which are actually, equipped with all the necessary documentation for the ongoing care. It is done in collaboration with the Nanteresa University Hospital, and based on the documentation, these patients that are actually the ones that show up and receive treatment in Albania, we start their follow-up procedure, and in this point we actually discussing with them to see what is the best way to be closer to them. What is disturbing us is the absence of a standardized protocol approved by the Ministry of Health. This protocol will help in providing medicaments and following up patients. We have lack of trained staff. We want not for only online part, but also for the visiting part as well. And what is worth noting here is the lack of modulators and the essential therapy such as alpha-dernas and tobramycin inhalers, which are insufficient, and therefore doing the protocol approved by the Ministry of Health, we also have a deficiency or lack of psychological support.
And I'm a pediatric pulmonology from Bambino Gesù Children's Hospital in Rome. Thanks to the organizer for organizing such a wonderful event, and thanks to ECFS and CF Europe for developing such an outstanding program. In the picture, you can see our multidisciplinary team. This was a conference. I'm testing the pointer, okay. You can see this is Professor Renato Cutrera, who is the actual director of our center. Here it's me. This is Federico Alghisi. He is a gastroenterologist in full-time in CF. You will meet him tomorrow. We have here Sonia Graziano, here, psychologist, who will deliver tomorrow a presentation on mental health. And we also have CF nurses, physiotherapists, patient representative, resident in pediatrics. Dietitians are not here, but we have dietitian in our multidisciplinary team. Maybe they were asked to shut the picture here, I don't know. We care from around 400 patients. In our center. This is a picture of our outpatient clinic. In Italy, according to the last report of Italian CF registry of 2022, we have around 6,000 patients. We have a lot of CF center. There is a national law, and we have, according to this law, we have one center per region. In some region, we have more than one center. You know, we are a country and relatively low prevalence of Delta F508 mutation. We have around 40% homozygous and 30% heterozygous on Delta F508. The biggest issue in my country actually we are facing is transition. Almost more than half of our patients are adults, and we have only 3 adult CF centers. The others are, such as ours, are mixed centers. So, as you know, we went to Tirana with a delegation of Bambino Gesù Children's Hospital from the 15th of January to the 18th of January. We had the opportunity to meet Irma and her team and discuss cases of patients with cystic fibrosis. We shared educational material. On the top image, you can see Sonia explaining the CFQR, which is a tool on mental health. I think she will speak of that tomorrow. And on the bottom left, you can see Rachele, who is a CF nurse, who is showing some material on a guideline on infection prevention and control. And on the bottom right, it's me doing random things. This is Paola Leone on the left, who is the head of our physiotherapy service, who is training Sergio, an excellent respiratory physiotherapy in Tirana, with the help of a young man with cystic fibrosis we met. We had time to meet patient representative. This was probably my favorite part. Meeting parents, it's my job, and it's always pleasant to meet persons like Fiorza and her husband who are here, and Gladiola on the right, who we know because her child comes also in our center in Italy. Irma is a very powerful person, is very cheerful and committed, so we had a lot of time for networking, and if you speak some word of Italian, when we say networking, we usually mean food. We also had one day the opportunity to meet Professor Irena Kazmi. She showed her brand new building of pulmonology ward on the upper left, who was behind that door. And we also met Monica, who I thank for making some time to meet us. We indeed faced some challenges at the start. We had a false start because my hospital management withdrew their permission to start with the mission. So we started on a remote meeting, firstly with emails, messages, and Zoom calls, and then we had a wider call with also the other members of the team. For this year, we plan for the Albanian team to come to Rome. We are hoping to have some more remote training. We hope that Irma and her staff could. Oh, it's there. We hope that Irma could attend some CF conference in Italy. We hope to be supporting some decision making and writing some internal guideline, and of course more networking. I give the floor to Irma for the final remarks. Thank you.
Thanks to everyone. As I said before, it is an opportunity, big opportunity indeed. A fruitful one, which actually, to me, as a pulmonologist, which is a new step actually dealing with these patients and and help these patients as much as I can. I would like to thank Fabio with his team, and a special thanks goes to Katarina. Thank you.
This insightful presentation on your collaboration. As Pavel already said, there is the collaboration between the centers, but there's also the collaboration between the patient organizations. So I'll ask Fiorza and Silvia to come on stage and share how they, as patient organizations, work together.
Greetings to everyone. First, I'm very happy that I'm doing this presentation in Albanian, so knowing the situation in my country. I thought it would never happen, and thanks to these two ladies here, made this possible. Thanks to the unwavering support and work from my colleagues. My name is Vjorza Molahaj. I'm a patient representative of patients and parents. In Albania, we had a very fruitful twinning project with the Roma Hospital Bambina Gesù, which actually you had a twinning project with the Shevchendrochi Hospital. We had a very good, benefits, informing, clearing up, and the path and treatment of patients by Bambina Gesù team. Besides the additional information, fruitful cooperation with regard to the methods and techniques, nowadays technique in treating patients. Coordination about the politics for creating the organization. I have a very good news that we are a step before signing the first active organization in Albania, and knowing how the situation is in Albania, this is one of the largest steps about the cystic fibrosis field. The achievements are the registration of the organization, organizing parents and patients. We know that's a small group of people, but we have identified patients and parents that are actually ready to join in order to do better for our challenges. Our objectives are running of the organization, creating awareness and informant activities. We have minimum information, and it comes from not so serious sources. They receive information from different sources, but never from a trained system. Creating a register with full statistics of patients and with genoptics, creating, facilitating communication and information between patients and nurses through an electronic system. So all the patients come to the hospital to receive information how a medicament should be taken. A few days ago, they had to take an additional medicament that they had to come from a faraway place, to be informed how a medicament should be taken. And this should not happen, having in mind that this disease is for a long time there, So with a commitment, and being a nurse is a mission, is not just a duty. The current situation actually is rather difficult. We have a lack of information, lack of institutional cooperation, and we have also lack and difficulty in finding medicaments. Those that we can find is rather difficult to find, but and some of them are not there at all. So what we expect is coordination and information about the way how to organize and raise awareness activities. We are at the first point, and we want to be informed by experts, by first hand, in order to know that how we will get to those who have been touched by the CF. We need to learn and what are these projects and where should we knock in order to find a serious to get what we pay taxes for. Better structuring of the internal organization. As this is us here, we are colors, we are lights, we are flowers, we deserve to live longer. No doubt that with the work of your parents and the nurses, and we will make this cystic fibrosis and the organization in Albania be the strongest in Europe as well.
Very much. Good afternoon, everyone. I'm Silvia Ranocchiari from the Italian Cystic Fibrosis League. It's an honor for me to be here today to share the twinning project between Italy and Albania and to show how collaboration can empower patient organization and can improve quality of life of people with cystic fibrosis. The Italian League of Cystic Fibrosis is the national is the national organization for CF patients in Italy. For over 40 years, we have worked alongside parents and patients with cystic fibrosis across country, collaborating with regional CF care centers. Our activities include maintaining the Italian CF registry, which collects updated clinical and demographic data from all people with cystic fibrosis followed in our country. Our mission is clear. We stand alongside every person with cystic fibrosis and their families. We work to ensure access to care and social opportunities, aiming to improve quality of life. We support research and innovative care and strive to overcome any obstacles, whether medical, bureaucratic, cultural, or social. We envision a patient-centered care and the defense of patient rights. We aim to support research that improves the life of people with cystic fibrosis, foster coordination among stakeholders, and build a strong and united CF community. This vision guides all our actions at home and in our partnership abroad. And this leads us to our partnership with Albania. Our goal is to help establishing an independent and sustainable CF patient organization. We bring our experience, knowledge, and best practice to the table, sharing what we have learned in our journey in Italy. We have already started the first meetings and the change have taken place, and we are working together toward a common goal. We can provide training for leaders and volunteers, support advocacy initiatives, and facilitate networking with other CF organizations. Together, we co-create strategies tailored to Albanian families and patients. We cannot interfere with healthcare institutions or provide direct financial support except for specific shared projects. We are mentors and partners. The decisions about Albania's future CF association belongs to Albanian families and patients. Our approach is built on collaboration, aiming to assess the extent to which the Italian experience can be adapted to Albanian context. We have already conducted online meetings, identified the priorities. We are now planning the next steps to support the creation of a structured and sustainable CF patient association in Albania. We will continue with workshop and training while supporting advocacy efforts with local institutions, aiming for an independent and recognized CF community in Albania. In conclusion, patient associations are fundamental in the fight against chronic diseases. They offer multidimensional support that goes far beyond clinical care, addressing emotional, informational, and social needs. Together, we are building a better future for people with cystic fibrosis in Albania. By sharing experience and creating new opportunities, we walk these paths side by side. Thank you. Thank you for your attention.
So thank you very much. Thank you really for such a lovely feedback, and to see that there is definitely the collaboration not only between the centers but also between the patient organizations. So thank you very much.
Thank you.
Okay, so let's move on to the next twinning fair, which comes from North Macedonia and Germany. So please, Valentina Cwiejowska-Holakowska and Mariam Stahl.
Okay. Dear professors, dear colleagues, dear organizing committee, dear patients and their families, I'm honored to be a part of this CF conference meeting. I'm Valentina Cwiejowska-Holakowska, and I'm coming from University Children's Clinic, where is CF pediatric CF center. This is a picture of our CF team. We have 110 patients and multidisciplinary team with pediatric pulmonologists, pediatrician, 1 dietitian, 1 consultant, 8 nurses, physiotherapists, 3 psychologists, and social worker. One part of this team are here, and I'm very proud of them. Few words about the Skopje, the capital of Macedonia, is neighbors of Kosovo. Macedonia is neighbor of Kosovo. We have more than 500,000 of inhabitants, and our clinic, University Children's Clinic, is part of Campus Mother Teresa University Clinics with 1,000 and more than 16 inpatient beds. Our clinic have 233 inpatient beds, 12 departments and intensive care unit, and CF Center, Pediatric CF Center, is a part of Department for Pulmonology and Cystic Fibrosis. In our clinic is also a national screening laboratory, and we perform a newborn screening as a national program which means that all babies, newborn babies born in public health or private clinic are screened for cystic fibrosis. We're also very proud of that. And how we start the twinning project? It started in January last year with application for the project, and 1 month later we've got big news that we were accepted for the project as a mentor site, with clinic on CF Center in Charité in Berlin, led by Professor Miriam Stahl. First, at the beginning, we have Zoom meetings. It was a meeting for introduction of the project and introduction of the CF pairs. And at the beginning, we have some Zoom meetings, online meetings. We are very familiar, all of us, with it since the COVID period. First meetings were exploratory, they are so shiny for us. We were at one side we were so happy, but at the other side we were so excited because we were chosen to be side by side with one of the best team, with team of Professor Miriam Stahl. And after first meetings where we have some discussion, we decided that our team, our mentor team, should visit mentor team in Charité in June last year. We've been 3 doctors, nurse and physiotherapists at the beginning, and there are some pictures of our online meetings and of course of our visit at Charité. Of course, that we were introduced with CF care protocols, with procedures, diagnostic procedure, but also we have to say, to be honest, that some facility limitations are in our center, as lung clearance index chance to be measured, because we don't have multiple breath washout analyzer, and also nasal potential, because we don't have also volmeter potential differences. Now, the floor is yours.
Yeah, thank you, Valentina. This was a very nice introduction into the first steps of our partnership. My name is Miriam Stahl. I'm from Berlin, from the Charité Hospital, and I'd like to give you a short insight into our mentor side. We are not that sporty, so we don't have a photo showing us in running shirts. So this is more or less the core of our CF team with a lot of disciplines, and we follow more or less 360 CF patients that are both adults and also children at our site. As you may know, Berlin is the capital of Germany, and we have quite a number of inhabitants there. This is actually not a view on a Charité building, because they are not that beautiful. Some are, but most are not. But this is a view from the roof of the highest Charité building looking east. And I thought this is a nice picture with this conference in Southeastern Europe to take this view of Berlin with you. And you can see some very interesting things of Berlin there, with the nicer parts, the island with the museums. Oh no, this is the wrong thing here, and the famous TV tower, which can be seen from almost everywhere in Berlin. The Charité is one of Europe's largest university hospitals, and we have also a large, but not the largest, CF centers of Europe. And then we have also tried, as Valentina already mentioned, to meet on different occasions. And we also plan to visit the Menti site in July. And I think we also have plans for you to come again in in autumn this year, so then we can catch up on the first steps that we experienced. We exchanged some information, some of our SOPs, and I think it will be interesting to see how our standards of care can be translated to your side, because I think what everyone experiences that there are official guidelines from the ECFS, and then you get to your own site and recognize, I can't do everything as recommended in this official paper, so I have to adapt it to my situation at the center. And if you get a standard of care from another site, it is the same procedure again. You also have to adapt that to your local situation. Yes, and I'm quite happy that we're also getting to solve, hopefully, some very interesting cases of our patients. And I'm also here to get some material from one of your patients to take that to Germany to do some interesting, or hopefully interesting, analysis on that to clear a case where the response to CFQ modulators is not so good as we would expect.
How we address some of the challenges with motivation and commitment from both sides. Trust and personal match is the best basis for the further collaboration, of course. Sharing experience, regular consultations, building a strong network of CF care, already said, Professor. And I believe that dedication can be the very strong and valuable thing that is most important in achieving all goals and making impossible thing possible. What are the objectives for 2025? Already one goals done. Mentor-mentee meeting at SEC 2025 in Kosovo, Pristina. Then next in June in Milan, Italy. Schedule visits in July, already said. Visits in autumn to mentor site. Regular ongoing patient discussion meetings, and of course continued collaboration with specific questions. Thank you very much. Thank you, Miriam.
Thank you very much. And in North Macedonia, we have also another twin since 2020 in another CF center in Kozle. And we have here Tanya Maretti, and she will present their twins alone.
Good afternoon to all of patients, doctors, professors. I'm very honored to be part of this conference. And we are, twins with Cambridge, with Dr. Charles Howard and Dr. Donna McShane. This is the picture of our CF team at Kozle. We were at ECFS 2022. The CF Center mentee site is with me, Professor Dr. Tatiana Jaťovská-Maretti, Assistant Dr. C. Ivana Arnoudova-Danevska, Dr. Elena Ginovska-Tasevska, Dr. Tanya Savin. They are all there. They are all here. Number of CF patients. We are taking care of 35 adult CF patients and waiting for the other 30 to be transferred from the pediatric clinic. We also have a multidisciplinary team with consultants, ward nurses, physiotherapists, dietitians, pharmacists, social workers, psychologists, microbiologists, radiologists, ENT doctors, and they're all here at this conference because we take the opportunity. It is very close to our country, so they all came. Let me repeat myself. North Macedonia, Skopje, the capital city. We are near the Greece, Bulgaria, Kosovo, Albania. This is our nice city, day and night. This is the University Clinic for Respiratory Diseases in Children, Kozle. This is the new CF Center, which is opened in 2016. In this place, it was 60 years ago. It was 60 years old hospital. It was the Institute of Tuberculosis and Respiratory Diseases. This is mountain, Vodno. This is at the base of the mountain, so it's full of fresh air and trees and flowers and everything. So the government decided in 2016 to rebuild it. So they grounded the old one and they made a new one, in which the government decided to be positioned a new CF center. So with outpatient, inpatient facility designed to minimize the risk of cross-infection. In November of 2023, this Institute of Pulmonary Diseases became tertiary institution. It is a university clinic for respiratory diseases in children Kozla now. Our mentors, Dr. Charles Howard, Dr. Mershane, and Dr. Flotta. This is a picture because they came in May 2023 and they discussed with the Minister of Health and also with the First Lady of the President of Macedonia and the whole cabinet. And they help very much the people with CF in Macedonia to get the modulators. So they were talking and finding some ideas. So after that, they were decided that all of patients who are eligible for Kaftrio in Kalideco from 12 years to get their drug. Also, they were telling them about the best standards of care, what their reviews for our hospital were, because they were at our site in 2019. So they have speak with every patient we have. They saw our how we work with the patients, how is our knowledge. So we were in contact before. So they helped very much. Also, many thanks to Professor, not only Charles Howard, but Isabelle Fajac, and everybody from ECF board and from Dr. Drevinek, and who helped us very, very much, writing letters to the presidents, to the Ministry of Health, and this was the last chance, and we did it. This is the CF team at the hospital. So the CF department center is like a department which is aside from the other in the one building. This is inside. We have 8 rooms like in suite. They are only with bathrooms, with refrigerators, refrigerates, television, and every room has oxygen and everything what is needed. This is outpatient room. We are also where we do the spirometry. This is the sweat test room. There is a cabinet for allergology, microbiology, and ETN cabinet where bronchoscopy is done. So what are current facility limitations and resource gaps in our center? Current facility limitation is CT scan at the clinic, because there is CT scan at the pulmonology clinic, and we tend to have monthly joint clinic with the radiologist. FibroScan, we use it at the gastroenterohepatology clinic, monthly joint clinic with the hepatologist to manage CF liver disease, and monthly joint clinic with the diabetologist to manage CF-related diabetes. So we need to reintroduce the fecal elastase test. We have some malfunction device, and the resource gaps is to have bigger budget. What about the mentor side? You already know them. The CF mentors are Dr. Charles Howard from Royal Papworth Hospital and Dr. Donna McShane from Addenbrooke's Hospital. They take care of 400 adults and 200 children. They also have multidisciplinary team, consultant, training fellows, special nurses, ward nurses, physiotherapists, dietitians, pharmacists, social workers, and psychologists. These are their, this is the picture of their adult CF team at ACFS 2023. So there are 11,300 patients in UK CF Trust Registry. It's about 60 people with CF who predominantly live in the east of England and are cared for the Cambridge pediatric and adult teams. They also have new adult CF center, and they opened 2019, also with bespoke outpatient and inpatient facilities designed to minimize the risk of cross-infection. They are inpatient rooms and outpatient rooms. We've been there, it's fantastic, so we are glad that we've been there. So what have we accomplished since beginning? We accomplished high-level strategic discussions with hospital management, Minister of Health and First Lady of North Macedonia in support of CF service, on-site visit of mentor team to Skopje 3 times, on-site visit of Minty team to Cambridge 1 time. We did the review of patients, discussions, teaching of MDT, particularly in relations to CFTR modulators, lecturers at conferences in Macedonia twice. What challenges we have encountered and how we have addressed them. Face-to-face visit helped to build relationship between the teams and to better understand the resource constraints, training requirements. Meeting the CSF conference and other events is beneficial between face-to-face meetings. Online discussions have proved difficulties because due to poor internet or speed or language. And we found that WhatsApp is very useful for rapid advice because our center takes care of the most difficult cases with CF, and we really need quickly advice from our mentors, so we did it some few times. What are the objectives for 2025? Arrange further on-site visit if possible, continue to meet at ECFS or ERS conferences, provide online support and when needed with WhatsApp, and provide strategic support in relation to hospital management and Ministry of Health. Thank you very much.
Thank you very much for taking it all on you and to give us a good overview of how your twin is collaborating. We stay in North Macedonia for one more presentation, so I welcome Elmir on stage.
Thank you very much.
Thank you to all. My name is Elmir Seyfulay, parent. Ilir's father, a patient with cystic fibrosis, who is 5.5 years. I do come from North Macedonia. I will speak in my mother tongue because it is easier for me. A lot of things already said here related to the professional way of talking about the cystic fibrosis. I found reasonable to provide a presentation from a parent perspective on how a parent confronts with his children with cystic fibrosis. Really, if we do consider the background of this disease, we might say that today parents who faces this disease of their children might breathe a bit freely because the science and doctors made that we have opportunity in a regular manner and a better way to treat our children, especially in North Macedonia. I have to thank all doctors who deals with cystic fibrosis, but all members of Association of Cystic Fibrosis who have completed an extraordinary work in the civilization of this disease, even within state institutions, but even working to be educated and professionalized with the intention that patients with cystic fibrosis have best possible treatment. Really, in North Macedonia, CF patients have a ground treatment, very powerful one, with all ensured medicaments. Of course, there is a lot of work to be done, but we hope that jointly with the association and doctors, we will manage to achieve this as well. And of course, I might say that when my son was diagnosed with cystic fibrosis, earlier my son, that was a overcoming of the world. Like, of course, we were not recognizing this disease before, and in the first consultations with our doctor, Professor Stojkofusic, we do understood what the disease is about, and even she tried to encourage us. However, she was realistic, and with this combination of psychology and realism, indeed, we understood that we have to do a lot jointly with my family and try to treat as better as possible our son with the help of the medicine and our doctors. This is the result we have obtained from the Academy of
kemi përqindje më të lartë
than adult patients, and we are more than proud on our multidisciplinary team. As you can see, we have a really huge number of CF dedicated specialists in our multidisciplinary team, from pediatric and from adult part of center. And as the situation regarding growing and ordering of our patient, we change and include new specialties in our multidisciplinary team, but you can see that we still don't have administrator. So Croatia, as you know, is a small country at the south part of Europe. We have not so many inhabitants. The number is lower and lower during the years. And as you can see, the incidence of cystic fibrosis in our country is 1 per 3,000 of birth. We believe that the number may be a little bit higher, but we still don't have a national neonatal screening program in Croatia. So our center is part of University Hospital Center of Zagreb. It's the largest health institution in Croatia, and our SAFE Center, as exists today, is established in 2017. So we have, as I mentioned, two parts. Department of Pediatrics started to take care about CF patient much earlier in the 70s, and my hospital, Clinic for Respiratory Disease, started to take care for adult CF patients during 2015. Today, we take care for almost all patients with cystic fibrosis in Croatia, 90% of children and all adult CF patients. Of course, each CF center has some limitations and problems and, of course, challenges. At this moment, the biggest issue in our center is a result of earthquake, which was very hard in 2020 in Zagreb, and the most of our hospital was hardly damaged during this earthquake. And at this moment, our hospital is under construction, and we have significantly reduced hospital capacity in our hospital. Of course, if we try to see what is the biggest challenge at this moment for our center, we have achieved a lot during the past years. So today we will say that the biggest issue is that we still don't have PARI inhalers and airway clearance devices on the positive list of our national health insurance. That means that the patient should buy all these devices. And certainly the biggest issue is that we still don't have a national newborn screening, as I mentioned before. So now I will shortly present you the mentor site. It's a CF center from Copenhagen, Denmark. The head of this CF center is Teresa Katzenstein, and they have a little bit higher number of CF patients, 200 of children and 100 of children and 200 of adults. They have a multidisciplinary team with CF nurses, CF physio, CF pulmonologists, endocrinologists, and they have a collaboration with some specialties. Croatia is on the south, Denmark is on the north, a little bit higher number of inhabitants. Incidence is also a little bit lower, and I have to say that our mentor site is one of the oldest, and this center is established in 1965, so it was the first Scandinavian CF center. Also, the connection between these two sites or center is that Denmark, Albania, and Croatia have the highest prevalence of mutation Delta 508, and this is something that is connected. So what we do during the beginning of our twinning collaboration, we have several Zoom meetings. Also, several Zoom meetings was organized for our patient CF organization. And just a few days ago, at the end of March, the mentor-mentee meeting in Zagreb was organized. And we are very proud because during these 3 days, we organized very successful and very fruitful program during which they visit our site. The colleagues from Denmark also was a part of our multidisciplinary great team, and what is certainly most interesting, and it was very big success for our center, was a physiotherapist workshop. So the leader of this workshop was a physio from Denmark. Also, we organized CF Symposium, which was dedicated to present the results and the state-of-art presentation of a member of our multidisciplinary team, but also from Denmark. And also we organized a hybrid meeting with patient organization, patients and their families. So this is the result for now. In the future, we hope that we will organize visit of our CF Center from Zagreb to Copenhagen during the autumn this year. And also we believe that we will start with the collaboration in some project publication and scientific research. Also, as I mentioned, the biggest problem for us is lacking of newborn screening in Croatia, and we believe that we can use some elements of Danish model to finally develop our neonatal screening program. So this is all. Unfortunately, our representative from patient organization didn't come. They couldn't, but at the next meeting, I hope that they will be with us. Thank you.
Thank you very much. I think we can have time for one or two questions if there are.
Not I can say a few words. So I really enjoyed your presentations and different variations of twinning project. And I have to say that it's not so easy to connect patient organizations. So we work on it really hard for 1.5 years. And I am happy that we had here 2 patient organization twins. They really started to cooperate, and I want to promise also to North Macedonian patient organization that we also work on your partner, and I hope that very soon we will connect to you and you can start your cooperation. But I have to say to North Macedonia, I remember, and not only me, the situation 20 years ago when mother from North Macedonia came to CF Europe community and talk about the situation, and I have to say that you've done one amazing job and to move the situation dramatically. And so for me this is example that yes, we can change our lives, we can change the situations in any country for CF patients, for CF families. And I think it's also for healthcare professionals that you also feel better if you have facilities, if you have equipment, if you can really treat the patient with all possible medicaments and treatments. So we can continue.
Thank you, Katarina. And I would say please use the time these days to continue networking, continue knowing each other, and I think it's time for coffee now.
gentlemen, I invite you all, please, to come and have a seat so we can proceed with our program. We have some interesting speakers, and maybe someone can ask the people who are in the coffee corner. Yes, see, be welcome. Okay, I hope you all enjoyed your coffee break. I know it's a long day. We had quite some information to digest, but it's very interesting information. So in a way, it sort of energizes me too. We would like to continue with in enhancing CF care, the role of standards of care and registries. And I do promise you that it's going to be really worthwhile to listen to. So our first speaker is Marit van Oorschot, and she is presenting also in the name of Marianne Kruiswijk. They are nurse specialists, or would you say nurse practitioners? That's the question, in the Utrecht CF Center. And she will give a talk about the European standards of CF care and the importance of centralized care models. Marit, the floor is yours.
Thank you very much, Ms. Noordhoek. That's right. I'm planning to tell you something about the European standard of CF care and the importance of the centralized care models. First of all, I would like to tell you something about the purpose of the European standard of care. Then I would like to talk something about the definition, how the standard is developed, and what does the standard look like, and where can you find him? Do you know where you can find him? I will explain, and maybe you have a question afterwards, and I hope I can answer all your questions, or maybe later on tonight or tomorrow if you have. So, what is the purpose? The purpose of the standards is just like a guideline. We made a guideline, and the guideline is made by many people involving the care of CF. And this ensures that the patient with CF receive the most optimal care, high quality care and safe care. And if you look at the pictures, you see 3 children. They all would like to see a football game. But there are only 2 people who can see the football game, and there is 1 guy who is staring at the wall. But if you look at the standard, we try to give equal opportunities for everyone. So if you do it like that, then you have the second picture, that all 3 children can watch the game. I hope you understand. So the care, the standard is also care consisting across all the countries, we heard. The European standard of care is, the first consensus was in 2005. Then a lot of things changed in CF world, and in 2018 there was a next standard of care. And the standard of care, many healthcare professionals in CF were working on it. It were not only doctors, not only nurses or nurse practitioners, dietists, but there were also people with CF were asked how you would like to be cared of with your CF. And next to the patient, also the families. And a very big part of that was also from the patient organization. So they all together, as a team, they worked and they made the standard. a few years later, there became new medication, the CFTR modulators, and there were no guidelines for the treatment for people with CF who take the CFTR modulators. More and more people were starting with the modulators, and there was an increasing knowledge about these medications. So the European Society of Cystic Fibrosis has released a new version, and that's why they call it the new European standard of care. Where can you find the standard of care? The standard of care you can find on the website. Maybe a lot of you know where you can find it, but just look on the ACFS website, and there you can find it. It is, I think, only at the moment in English. No?
Oh, we bring them now here, translated in Albania.
Oh, okay. Okay. So you all can read it then. And you also see about the Twinnings project. So it's a very, very good and nice website just to look at. And I would like to tell you from the standard is divided in 8 key points. The first very important key point, I heard it this afternoon a lot, but that's the early diagnosis. It's important of the newborn screening, early detection. So the earlier we detect CF in the patient, in the person, the better quality of life he or she will have. The second one is a multidisciplinary care. I also heard it this afternoon. It is involving a team with a lot of specialists. And then the infection control, strict measurements to prevent cross-infections. The fourth one is the efficacy and the medication. There are new medication, and there is a lot of medications like CF-related medication. Nutrition and management, the support to maintain healthy weight and manage CF-related diabetes. The sixth one is respiratory care, so regular physiotherapy and the use of the medication. I don't know, but in the Netherlands we have pulmozyme, we have hypertonic saline, we nebulize. I'm not sure if you can do it here as well, but that's very important for us. And a 7, the psychological support and the social support, because maybe your child or your friend has CF, but also the family and brothers and sisters, they need definitely support. And at last, in the standard, is it about the organization of care? How is your hospital, how did you manage the care? I mean, do you have a lab for sputum? Do you have enough room? Do you have enough place? These are the 8 key points in the standard, very short. And I think maybe you think now this is a very theoretical talk, and it is, but I want to convene that the standard will help everyone involving in the treatment of cystic fibrosis. By following this guideline, you can provide the best care for the CF patient. Of course, it is within the limits of the country in where you live. So you can ensure that everybody gets an equal chance. Thank you. I don't know if is this correct? No? No? Okay. Is there anyone who would like to ask me a question? Not everybody. Not everybody.
Feel free to take the opportunity. Raise your hand, and I think we have a mic over there. Anyone? Can I then maybe ask you a question?
Yes.
Like you mentioned the word, you said it's more or less of a theoretical talk, yet I do feel that the implications of these guidelines are very, very practical.
So I mean, I'm just telling 1, 2, 3, 4. You know what I mean? That's a little bit theoretically, but you have to read it. You have to use it, and it's sure. It's practical.
But it's a step-by-step document, I think, and I think it's very helpful in a way to develop the standard of the standard of care, and that way improve treatment and make next steps for treatment and a longer life and a better quality of life. So I just wanted to add that I think these kind of guidelines are extremely important for all of us, and not only for people in healthcare professionals, but also for patient organizations and also for
the patients themselves,
parents themselves, when they start digesting what they have just been confronted with. Okay, just the last opportunity for the audience to raise your hand and have a question.
No, okay.
And if not, thank you very much, Marit, for your wonderful presentation. Well, that's quite a stunning start of your talk. I would like to introduce to you Lutz Nerlich. He is a German pulmonologist for children, and well, I think the topic itself, you're perfectly able to introduce that yourself.
Yeah, thank you very much for the invitation. It's really a pleasure because I have visited also some of the centers and the countries I'm talking about. I'm a pediatric pulmonologist. I'm involved in the registries, and you heard about the topic registries from different sites, from the larger national registries, and I would like to give you an update on that. I think we all are in one boat, I think. CF in Europe is one part. It's a global disease. I think it affects mostly white people, but I think it's always a question, what is the prevalence? How often does it occur? What is the genetic background in each country, especially if it comes to treatment? What is the age distribution? We heard about the difference between children and adults in different countries. What's the lung health, the nutritional status, the access to treatment? And we have to know, I think, the economic situation is very different. So we are all on our own boat, but I think with one healthcare system in our country, access to diagnosis, to treatment, and if we want to overcome it, if we want to cure CF, I think we have to learn from each other and to take the best from the other experience and from the more advanced, but also need to facilitate that. That's the reason why registries were started, and I think in the 60s in the US, I think that was a great moment to really collect data of patients with cystic fibrosis, to analyze them on a center level, and to use the data in different ways. And it comes from national registries in larger countries, and you see here the development, I think, in Italy, in Germany, in Denmark, and also Sweden, and we heard about the Netherlands. So around the 90s to the 10s, I think, of the last century, but not all countries are covered. And in this situation, the Association of Caregivers in Europe, the European Cystic Fibrosis Society, sets up a European registry, the ECSF patient registry, and it starts in 2003 with a very ambitious game, I think, to cover the European region, the WHO region of Europe, have a common data model and a data protection model, and use pseudonymized data. What does it mean for patients? The names of the patients are not shared with us. It's in the center, in the countries, so I think we are not touching any individual data, I think, but I think we collect the patient data. There are inclusion criteria and harmonized variables so that you can compare the data from different countries, and the national registries, they adhere to them, to our definitions, so the data are extracted, and this gives us a chance to compare data, and I will show that. And it's offering also the chance to countries who do not have a national registries. A software version was started in 2011, a web-based system to collect the data based on informed consent of the patient, I think, for epidemiologic research and pharmacovigilance. Why a patient registry? We saw the list of the age distribution, but I think there are many tasks, I think. For a center, it's essential to know which patient do I have, what do I monitor, what do I miss in treatment, and how to identify areas of improvement and to measure the improvement over time in age or in lung function. But it's not only, it's a patient advocacy, I think, who know How many patients are there? Which age distribution is there? What are the gaps? This is very important. And to lobby with health authorities, I think we need the data because they ask, is it 100, is it 1,000 patients, it's 5 patients, and what is the needs, I think. For the patient and families, it's very important to discuss, I think, with their doctors, the outcome in the countries and the challenge. And especially in this region, we saw that a lot of patients are cross-border treated. I think in Kosovo, some are in Macedonia, some in Albania. I think the patients look around where the best care and where are the best opportunities. But we have also the healthcare authorities who ask you, I think, how many patients do we have to treat? How much is the budget needed? And also the industry, where are the unmet needs for clinical trials? So there are many questions, and the patient registry tried to solve them, I think, and to support these developments. What is collected? It's collected in annual data sets, so it's reasonable. I think it's more on the core data, demographic, genetic, the genotype, the diagnosis, but also annual data like lung function, nutritional status, complications, pregnancies, and therapies. And I think we made a long story from 2003 to 2023. More than 42 countries joined this effort, and more than 56,000 patients are represented in the registries with annual data set. And I'm very glad that the Balkan region started in 2017, so not in the first place, but in North Macedonia, Croatia, and Albania pediatrics in 2017. That was a great effort, I think. But here we have the gray spots, I think. And now from 2024 on, we hope to see a collaboration with Bosnia Federation, Republic of Srpska, Kosovo, and Albania adults. So the picture will be more complete in this region. How can you access the data? And this is very essential that we are always reporting every year these progress and these data so that it can be used on a national level, it could be used on an international level. And the latest data from 2023 are reported in a highlight report. The more detailed one will come in June. But I think here we have the 22 data, and I will show you a mixture of both data, so it's always a little bit lag behind, I think. The number of patients with people with cystic fibrosis in 2022 is quite diverse. We have so much countries, and the largest one is with 11,000 patients, it's the UK. The smallest one is Iceland with 15 patients. But in this diversity, there's a huge diversity in care systems, in models, but also in treatment, and also, I think, in the healthcare system. Here we see, I think, the challenges around the smaller countries like Croatia, North Macedonia, Albania. I think less than the 200 or 300 patients, I think, but I think this is a distribution and this is a challenge to display these data also. The prevalence of cystic fibrosis is quite different in Europe based on the patients diagnosed, patients living in a country. And here you see, I think, that the largest one we can collect is in the UK and in Ireland, with 3 out of 10,000 inhabitants have cystic fibrosis. And there are countries, I think, we are lacking information. They might be underdiagnosed, the incidence might be different, or early mortality contributes to these differences, I think. Here we have it for Albania pediatrics only, but you see the gap, but it's also more a shift from the West to the European base to the diagnostic. The geographical distribution of Delta 508 was just mentioned. I think that we have Denmark, Croatia, and Albania who have more of the highest Delta 508 rate, nearly over 90%, but we have also communities in Georgia and Armenia where Delta 508 is less than 10% of all the mutations. And you see it on the map, I think, the darker blue, I think these are the countries, and we have that for all the other mutations as well, and stop mutations, and Turkey, Georgia, Armenia are quite different from the Balkan region, I think. The proportion of children and adults depends mostly on, do we collect all the patients? And I think we know very well that we have some gaps. I think in Albania, the adults are not totally collected, but I think in North Macedonia and in Montenegro, I think we have also, I think, these collaboration, and we see in middle it's 50% or more than are adults, and here in these countries we have a gap, or we are in the development to that stage. So the adult care is very important for the future, I think, to build it up and to support it, because this will be the future of the patients, I think, if we overcome the problems now and build collaborations. It's very difficult to get adults on board, but I think the numbers will rise, and in Albania is a good example where you show that this cooperation is definitely needed. The lung function over all the countries is nothing to hide, I think. We know there is a decrease in the lung function over the adolescents, and then it's a little bit more stable, but we have a huge diversity in the median FEV1, and this diversity, I think, is something that has to do with care structures, with antibiotic treatments, but also access to modulators. But it shows how much we can do and how much we can improve. Here we see, I think, from the 2022 report, the Croatian, Albanian, North Macedonian overview, and you see differences, I think, in the development over time in the populations, but you see what can also be achieved over time, like in Croatia, where it's quite stable until the 18, and the median FEV1 is normal, I think, in this population, and I think in the other countries, like in Albania, it's also a small number, but it's not too bad, I think, and there is always room for improvement also. The complications, cystic fibrosis has also to deal with Pseudomonas and bacterial infections. And here you see, I think, the chronic infections in children, I think, in 2023. And you see, I think it's, less than 10% in most of the Western countries, but up to, and the lowest one is Norway, with 0.8% of pediatric patients who have a chronic infection with Pseudomonas. And the highest one, I think, in Moldova is 41%. So despite all the modulator discussions, it's also a topic, I think, which has to be addressed. These patients are in need, especially in Moldova. They do not have access to the modulators, but they do not have access to the antibiotic treatment as well to a certain extent. And here we have, for example, North Macedonia, I think, but I think overall this is 23%, and in other countries, Albania, 18% in the pediatric. So this shows some room despite the problem of the modulators. That has to do with diagnostic tools, microbiology will come, therapeutic options, but also the modulators, and also access to diagnostic for the patients. The pancreatic insufficiency is mainly correlated to delta 508, and you can see it here. I marked it, I think, with Albania. Most of your patients are pancreatic insufficient, so I think in Italy it's totally the opposite. I think you see that 40% are pancreatic sufficient due to the fact that non-delta 508 patients are more prevalent. So that is a different population to compare with. But I think this is important. The nutritional status over all the countries could not be more different. Less than 10% overall are malnourished, but I think in some countries, I think we see a gap, I think, of more than 20%. So the nutritional status, I think, is something we have to face, despite all the efforts around the modulator, they will help. But I think there is a gap, I think, and there's some room for improvement. The use of modulators, and this is from 2023, and I think you can see here, I think in 2023, the number of patients, I think, who are on modulators has been increased dramatically. And from the eligible patients at that definition, I think more than 76% have access to the modulators and are treated with that. But there is still a number, and the most important is, as you know, Elaxacaftor, Tezacaftor, Ivacaftor, Kaftrio, but there are still also some gating mutations. Here you see, I think, and this is for 2022, eligible and treated for children and adolescents. And you see here also the countries. You see a difference. In Ireland, nearly 90% of the eligible patients are treated. In Albania, no patient is treated at that time. So you see the great gap, and you can show that to the health authorities. We are lacking behind. And if you look for Montenegro, and I'm very happy that you give a presentation later, you see your neighbors are far more advanced, and you can tackle your administration and government also with this close relationship. It's not Ireland, Finland, Sweden, but it's also, I think, the countries around you, like Croatia, who are far advanced, and that might also help you to persuade. For the adults, it's even more impressive that Montenegro is, due to the chance, I think, the country who leads the field, I think, here. So it's not always the economic system in the system, I think, who leads it, and in other countries it's more different. But you see close related countries, different pictures on access and eligible, and I think that's very important to convince the government also not to be behind the neighbors, I think. We have a huge diversity across Europe, especially in the Balkan region, as I showed, with access, but also with some results. And the broad access to the modulators is very important and will trigger the improvement to outcome, because the gap could not get larger. And we are, as a European patient registry, try to support local registries to hand over and to work together with the data. So all patients, I think, no data of your identifying data will be exchanged. So I think privacy is very important, informed consent, but making you visible as part of the population, I think, is very important. And we see that with mutations not treatable at that time. We have to develop things for them, and also industry and others recognize, I think, where are the gaps. And learning from each other, that's a topic of the whole, and it's an important research tool. Many thanks to all the patients who believe and trust in this system and support the doctors by asking for the informed consent, the CF centers. We have also some national CF registries, but we have also national organizations who support us. But CF Europe is a partner on that way, and I'm very happy that we are in one boat here and that we contribute to the whole knowledge of CF and the development. Thank you very much.
Thank you, Lutz. It's always so exciting about this kind of data. I think that they are, on the one hand, are really finger pointing for the patient, like where is the best care, and at the same time, they can be used for awareness when you have to convince your government for access to Kaftrio or whatever, modulating therapy. Very interesting. Any short question? Because of time, we can handle one question. If not, so thank you again then. And Katrina, would you be so kind to introduce the next speaker to us?
Oh, okay. So now we can continue with presentation from Balkan countries about the situation in their country in the connection with standards of care, registry, and system of care. So please, Laura, can you speak about Kosovo situation?
Thank you very much. I think it's difficult to speak after Professor Neely showing all the data and all the experience that he has, but I'm going to try to be short and explain what the state is right now as we're speaking regarding the treatment and care of cystic fibrosis in Republic of Kosovo. If we, I'm going to address it in English just because most of the audience is foreign, so maybe it's easier. If we look at the publication about the future of cystic fibrosis care as a global perspective, there are 5 pillars that have to be respected, like there's changes in the epidemiology of cystic fibrosis, evolving models of clinical care and diversity, expansion of CF care standards, advances in novel therapeutics, and increasing focus on patients' engagement. So where do we stand here compared to those pillars? We'll see next. I will repeat a little bit about the statistics that we have in hand right now regarding the capacity of the clinic that is the only clinic for children that is offering services to all the pathologies, including cystic fibrosis patients. We have 150 beds in total, but we have only 4 rooms, single rooms for those that are with cystic fibrosis that are designated. But when we have more admissions than 4, then we are really flexible to use the other rooms across the other departments or in pulmonology as well. So most common mutation that we figured until now is delta F508, but we have a smaller group that has other mutations, as you can see on the board. Later, on the latest years, the genetic testing is done abroad, still is done abroad, so outside of Kosovo, but is reimbursed by the Ministry of Health, which helps a little bit regarding the expenses of the patients. And I'm proud to say that we started newborn screening on January this year, so it's a big step for us, I think. But sweat chloride test was started was started during the 2013, during the period where 2 nurses were trained in Skopje for 2 months to know the techniques of doing iontophoresis, so sweat testing. Regarding multidisciplinary care team and collaborative medical approaches, current team is made of pulmonologists, gastrohepatologists, endocrinologists, clinical geneticists, physiologists, psychologists, and clinical microbiologists and CF nurses. We are really aware that there's a lot of improvement to be done on the current team that we have, but still we need physiotherapists and nutritionists really badly. As per clinical practices and routines that are done to these patients, we're really pushing as clinicians to have the patients come at least 2 to 3 times, 2 or 3 monthly visits. So every 2 to 3 months we have them visit the clinic, have their sputum taken. When they're smaller, if they're bigger, they can deliver the sputum sample themselves at the laboratory, so it's tested for bacteria and fungi. Most common pathogens are Pseudomonas aeruginosa and Staph aureus, but still there's no current testing for NTM or nocardia, which is really important for these patients. Still no IV antibiotics delivered at home, but we do IV eradication in the hospital only. This is our device that I'm showing in the picture. It's an older model of device, but still functional, and we use it to do iontophoresis. During 2020s, Dornose Alpha was introduced. Previously, patients had to buy that themselves and figure it out where to buy them. Otherwise, this one is on the essential list of medications since 2020. There's around 300 sweat tests performed annually, and the current therapies supported by donations were the vitamins, pancreatic enzymes, and hypertonic saline. Until the last 4 to 5 years, these medications now are all on the essential list of medications, so patients come to the hospital and they can take the medications. So it's free of charge, and everything all the costs are covered by the government. What the daily framework of our team is that we offer support 24 hours a day. We offer outpatient visits available for 5 days per week, so Monday to Friday. When the regular hours are for outpatients, we, so to say, we take these patients first, so they don't need to do an appointment previously. They just come, introduce themselves. Now we already know our patients, so we are familiar with each other, and they know the routine, so they don't have to go on through the regular procedures as other patients. They do a lot of phone consultations. I think it's a common way of contacting and consulting the doctors through messages and through phone calls. A lot of times they try to figure out how to continue with the medication or something if they have any trouble. They just try to have a shorter way, so to say, but still we are in the disposition to have and to answer every question and every issue that they have if it's something that we can fix through phone. So sputum samples are collected by trained staff for smaller children. We have a good communication with our microbiologist, who is going to present tomorrow, I think, a presentation about her work with these patients. We do annual imaging and biochemical testing, not just annually, but whenever these patients are admitted at the hospital or whenever we find it's necessary. The pancreatic elastase test in feces is self-funded. It's done in private practices. We do spirometry every 2 to 3 months, and we follow strict patient segregation. So we don't mix our patients with other patients.
not to CF patients or with other patients at all. So we try to do oral glucose tolerance tests for older children annually, abdominal ultrasound, biochemical assessment as needed, ENT evaluations once per year. We do a lot of consultations with hepatologists and endocrinologists, not just yearly. And it's nice to know that recently we have a psychologist in clinic that does the consultation for this group of patients also. Treatment protocols right now, we offer bronchodilators, hypertonic saline, dornazole alpha, and colistin. Most of the times, unfortunately, colistin is, so to say, adapted. The IV form is adapted for inhalation, but we have to do what we have to do. Then tobramycin, unfortunately, we don't have, so patients buy it themselves. Antibiotics as needed, and also the vitamins, and supported with extra vitamin D and pancreatic enzyme therapy, which is Crohn, that is also in our pharmacy. Our future goals and plans are to recruit new team members, support the current team, widen the number of people that are involved in managing and treating patients with CF, enhance the nurse training, which is really important to us. To build collaboration with the adult pulmonology team, because right now we are sort of a mixed center, so we manage pediatric and adult patients. And I know it's not ideal, but right now we are dealing with this situation, and then I think we can start to build the first step towards planning and making an adult pulmonology team. Then establish a formal CF center with expanded staff, launch a dedicated adult CF center, and also advocate for CFTR modulator therapies, which I think was the cornerstone of all our talks today. And of course, NPD testing, and to broaden the spectrum of bacterial testing, which is really important also. These are 3 pictures taken not in a long time ago. The 2022, the team was a bit different. You see some other faces that are not recognizable. And then we have, last year we met firstly with Katarina. She visited our center in August 2024, and we had the chance to meet with the senior doctors, gastrohepatologists that deal with CF patients. And currently this is the smaller team that we are working right now with the CF patients. We are aware that there's been a lot of changes during these short period of times, but nothing has changed our dedication to the CF community and to our patients. So together, I think we are stronger. Please, if you have some time, and use your time to visit some beauties of Kosovo. I know your stay here is really short, but I just wanted to show you some pictures, because Kosovo is more than just this hotel and the conference. Thank you for your attention.
Thank you, Laura. And now I ask doctor from Albania, from Children's Center and starting Adult Center. So please, Dr. Irena Kashmi and Irma Tashi, to explain a situation in Albania.
Good evening. I might say that we are in the early evening of this day. I would like to present myself before I provide some data about CF Center in University Hospital Center, Mother Teresa in Tirana. My name is Irena Kazmi. My involvement with CF patients dates since 2013, when my colleagues already retired who were involved 100% with these patients feel the need to add the staff who should be involved in treatment of these patients due to some reasons. First of all, because the level of care to them was going forward in a positive context. Average age of them was being increased, and surely the survival and their number was being increased. So the need for extra staff, respectively introduced in this period of time after one of my travels to Southampton for about 10 days, founded that time by UK CF test. Frankly, I was inspired to share my mind that I should be involved in this sector. I have to tell you that this is a disease that we treat and cure since 1992, which is about the huge changes suffered by Albania with the opening of the country and having the information from abroad, an opportunity of exchanging, even professional exchange of doctors of that time. So it is a disease we do know many years ago, and we treated years ago, since 1992, exclusively. The sick people are diagnosed at the University Clinical Center Pediatric Hospital, Pulmonology Pediatric Service, and afterwards pursued by during all the life, based on files and relatively accurate documentation on which we are based on putting data on the European Register of Cystic Fibrosis. I do know that regularly it is a contingency of patients on whom we, let's say, since 1992 up to the nowadays, regardless the progress is slow, because itself Albania is making a slow progress in all the fields. I do think that we have done quite a progress, quite a good progress. So the population of Albania, 2.4 million inhabitants, with a birth rate 11,149 according to the census of 2022. What kind of infrastructure we do have about this contingent of patients? So I made an introduction, are diagnosed and followed in the hospital center Mother Teresa, which is the only university hospital center where we have a university pediatrician hospital at pulmonology service with 5 beds dedicated exclusively for these patients, with a outpatient consulting room dedicated without a multidisciplinary team dedicated only for them. What this means, that there is no true team or respective team on cystic fibrosis, but this doesn't mean that these patients are not provided with service from gastroenterologists located in then ward, endocrinologists, cardiologists, surgeons. So regardless, these sick people exclusively are followed in the service for every need introduced while the disease, surely they do receive the service. So we have one center or unique center of cystic fibrosis dedicated for pediatrician patients, which, according to the reports of 2023, based on the National Register, based on the European Register of Cystic Fibrosis, we have 105 patients. I have to say that we have a variable number from a year to a year. This is because of migration. So a lot of patients requires a better service in neighborhood countries. And the number is being reduced. Regardless, disponibility and infrastructure we do provide, considering the deficiencies and opportunities we do have. It results that we have an incidency based on the number of new cases and birth rate, 1 in 3,300 patients, 7 or 8 new cases a year, with the average age of diagnosis about 0.4 years, let's say, in the first year of life. Most of them maybe in the first semester of their life. I have to highlight the deficiency we have about the neonatal screening lack, which might be performed only in the level of private hospitals, but this number belongs to that contingent which manages to confront the expenses private hospitals are incurring. What we do consider as a success is genotyping of patients. We have a rate of genotyping of patients in a level of 95%. The data mentioned by Dr. Lutz as well. So this genotyping, beyond the fact we have, and this is a positive thing, I have to highlight that until 2021, it was partly funded by a state and mainly by the patients themselves. There were certain periods, gap periods, where the projects, state hospitals, managed to create and cover part of expenses, blocked, and as a consequence, the patients were forced to pay for the genotyping. Fortunately, since 2021, hospital center managed to perform a panel of 11 mutations, the most frequent mutations for Albanian population, based respectively on previous data of genotyping. On the way, this has been proceeded snapshots of 11 mutations, surely not managing to reach rare mutations. A part of patients will be non-completely genotyped, but in the other hand, I am of the opinion that considering efforts even the genetic service is making to increase the range of genotyping, not only for genotyping of CF, but also for rare diseases entirely. I do think that in the future, with considering the efforts and the progress to have an NGS method, I do think we'll manage to overcome these impediments as well. So, as I said, we have following limited resources. We have no dedicated CF center. We have a lack of specialized teams. We have no diagnostic full opportunities. So we have some, but we don't have some other opportunities. We cannot manage to complete all within the hospital center. And because of this, we feel very sorry. Regardless, ongoing requests we do file at the institutions. Another important element that makes a part of patients will be manifested with a classic form, considering that it's predominant F508, as reported by the previous speakers, is respectively the lack of neonatal screening. There are efforts to include neonatal screening for all metabolic diseases in cooperation with the Rare Diseases Association. I do think that maybe this will be a not very far future, but however, this is a reality which we are confronting. In relation to diagnostic, we are grounded not only on the data, clinical data, but surely we are based on diagnostic criteria, performing two suite tests of type conductivity-based test. I have to highlight that this is a test which up to 2016 confronted by the hospital itself, but due to the reasons of laboratory organization through partnerships with the private hospitals, this kind of test not anymore performed. And regardless, this on this in a gap period since 2016 to 2024, where we are beneficiary of a grant from patient registry, so a program, one grant of patient registry of ECFC, we managed to perform within our service. We have myself and the nurse of cystic fibrosis trained to perform this, considering this is a very simple procedure, a relatively simple procedure. We are managing to fulfill this gap in this form, but of course this is not a final solution. I already spoke about genotyping that in 2021 started respectively to be done. This spectrum of 11 variants, but we consider this as a progress. In relation to data and registers, we have in disposal every sick person is registered. We have all files registering everyone, but we have no proper national register. There is an effort from the Association on Rare Disease to establish a national register on all rare diseases, part of which will be in the future. But fortunately, since 2017, we are part of European Register on Cystic Fibrosis, and frankly, since this moment, we have a more clear situation in regard to everything.
Having for the ages, have a clear data for the group ages would be the number of patients of the Staphylococcus aureus, chronic ones, pathological one related with diabetes and others. All these made us that we make a better planning. Our request addressed to the institution regarding the medicaments, for which I can say that we made progress in. So we are at this level of covering the medicaments and medical equipments regarding the CF. We reimburse partly, not 100%. Not all needs are met. We are calculating actually, and we are actually towards finding a solution with inhaled bronchos. We have, with regard to the bronchodilatators, oral macrolides, PDI inhibitors, and pancreatic enzymes. For many years are being reimbursed in our country. Of course, that as we annually report on them, regardless of the fact that we are a population with genotype would dominate the data, we would be, in Albania, we haven't received them. They're not in the Albanian market. There is a lack of liposoluble vitamins. That's why patients cover them by themselves, and a large part of supporting equipments, nebulizers and masks actually. Now I have to point out the role of the CF patient association should take. This association is kind of inexistent. It has been established early on in Albania, but its role was quite dim, I'd say. Today, Fjords are one of the parents that we deal with her force and power, can do something that an association can do, so, collaborating with professionals. Many awareness campaigns, the awareness that they do with families that are less economically developed, and that they have difficulties having health system education, available to them because they live far away from the university clinical centers or health centers. Meanwhile, we should point out that there is a society for rare diseases in Albania, which actually operates since 2012. It has been established by healthcare professionals with aims to create a national diseases register, national rare disease register, in order to support patients with rare diseases. As I said, earlier, we are making efforts to make a national rare disease register, funded and supported by this organization, by this association. What are the challenges and priorities that we have? It is very important, actually. The program actually is a national program, is quite important for screening, for newborn screening, which would allow us to find new diseases, expand genetic testing panels, and of course improvement of medication access. I consider here modulators, because I think that these tools I mentioned earlier have not been reimbursed entirely, but we are making improvements, for which I think that we will make the difference in this regard is by including modulators. That's why the association should take, organization should take an important, a significant role to push forward in local government and national government in order to reach this desired results, as I would call. Now I invite Irma to have the floor.
Center, there is so much to say, as we are new and we are the beginner of the beginning. But I should say, as I told you before, that the Adult Center was created in February 2022 as a need for the follow-up, support, and treatment of these patients. And the transfer of the patient, as I told you, has been done in collaboration with the Pediatric Center. Currently, there are 23 patients registered, but only a part of them have undergone regular follow-up, because most of them have gone abroad to take and to have their medication and treatment. Patients are hospitalized in the University Service of Pulmonology located in the Regional Hospital of Tirana. In this hospital, all consultations with the endocrinologist, gastropathologist, cardiologist, and surgeon are conducted, and as well as the imaging examination. So we do not have difficulties in examination or in following up these patients regarding the imaging or fibrobronchoscopy or fibrogastroscopy, also the ultrasound. Despite this, it's worth emphasizing that there are no dedicated rooms for cystic fibrosis patients, but we try and have the possibility for this patient to be hospitalized in double rooms. Difficulties in care, which is more important, are encountered during the transition phase of the patient from the pediatric to adults, where the goal is to increase awareness and communication with the patient directly rather than with the parents. And here I should thank you, all of my patients that believe in us and believe in me. And we have a great communication with them, which are the objective for the future. Creation of the cystic fibrosis protocol, which I mentioned before, based on the latest guidelines approved by the Ministry of Health. Training of nurses and physiotherapy staff in collaboration with mentor site. Entry of as many data and patient numbers as possible into the European Cystic Fibrosis Registry, and creation of an electronic database for the periodic follow-up of these patients. Thank you very much.
Thank you very much. And for me, it's really very sad to know about very bad situation of CF patient in Albania. I have a short question. Do you know the number of patients who are treated outside of Albania? It's not clear.
The number, it's variable, but maybe for sure I know 5 patients are children. I'm not talking about adults. Yeah.
And in adults, 10.
Yeah. Okay, so maybe we will continue, and I believe that together with your mentor and with support of CF Europe community and patient organization in Albania, and I know many parents are here, so I hope they will motivate themselves and really do more activities for changing the situation, and we all will support you. So thank you very much.
Thank you very much.
What we didn't realize by the other presentation was this thing, that parents and children are leaving their nation. So it's a pity for that, because of they require a better standard of care. So maybe Greece, because we are neighbors, Italy, America. So
Yes.
it's a pity for that.
Yeah, it's so, because
So
if
we are
you don't
losing
have care
numbers.
at home, you have to leave and save your child. But now
Yeah,
you
of
have
course.
standards of care to translate it in
Yeah,
Albania.
what we have to do is to improve the standard of care.
You can go
but
home
we cannot.
Yeah.
We have to allow them to go abroad and to make the better for their families, of course. Yeah.
Okay.
Yeah.
Thank you very much.
Thank you.
And now I will ask doctors from North Macedonia, from both centers, from Skopje as Children's Center, Professor Valentina Cvejovska-Čolakovska, and later also Tania Maretti, Professor Tania Maretti from Adult Center in Kozle.
Okay. Hello again. Now something about the CF centers in North Macedonia. I will start in early 1990s when CF section was a part of metabolic disorder department at University Children's Clinic in Skopje, and at that period chief of department was Professor Gordova. Few years later we become a part of International CF Mucofiscidosis Association, and with grant of this association start education of the doctors, nurses and physiotherapists in CF centers, and from 1995-96 the CF department became a center, National CF Center, led by Professor Fuštić. In 2011, we begin to collect data from the patient, and from 2014 we reported data, and from 2017 we become a part of European CF Society patient registry. During these years, start collaboration with other specialties, with microbiologists, oral specialties, radiologists. 1 year after CFTR gene was found in 1990, we started with genetic diagnosis. Swab test was performed from 1995, and advanced treatment started in 2008 with antibiotics. There was IV inhalation with tobramycin, colistin, mucolytics, hypertonic nasal chloride, and alpha-darnaza also is available in our country. Advanced physiotherapy also. And the last steps of the advanced treatment was in 2020, when 3 patients with gutting mutation got ivacaftor. 3 years later, 12 patients started with Kaftrio calideco, eligible patient, and the last year, 2024, was most challenging for us because all patients 12 years and above started with modulator therapy, and 4 children less than 12 years with advanced lungs disease. Some numbers about the patients. In Macedonia, we have 140 patients. The number is dynamic because some of them are living abroad, moved to another CF centers. We have 79 children, 1 CF center, pediatric CF center, 61 adult patients, and 1 adult CF center from 2016. We have 2 patients lung transplanted, and I have to say that from 2022 to 2024, adult patients were treated at University Pulmonology Clinic. Pediatric CF Center is a part of University Children's Clinic. We have a multidisciplinary team, as I already said, and we also, as a university clinic, we have also subspecialties like endocrinologists, gastroenterohepatologists, but also are available another specialties in clinical center like pediatric surgeon, microbiologists, radiologists, geneticians. From 2018, firstly, as a pilot study in our country, start newborn CF screening, and from 2019, newborn screening continues as a national screening program. And as I said, that every child was born in Macedonia, independently that is born in private clinic or public health hospital, is screened for cystic fibrosis. In our clinic is also is national screening laboratory led by Professor Anastasovska. As you can see, Macedonia is one of the countries where newborn screening is available as national program. There are some numbers during these years, and we can see that the number of symptomatic diagnosed decline. And this year we have 1 child diagnosed by newborn screening, and unfortunately 1 with symptomatic diagnosed at 11 years of age, and unfortunately with almost severe lung disease. As I said, in early 90s, genetic diagnosis is performed in research in the Center for Genetic Engineering in Biotechnology, Georgi Efremov, which is the part of Macedonian Academy of Science and Arts, led by Professor Plaševska Karamfilska. And initially, we screened for 11 most common CFTR mutation. And after that, if mutation is not identified, then center DNA sequences is performed. Macedonia is a country where is delta F508 is most frequent mutation. About 76% of our patients have in one or a homozygote. And we also have 26 other pathogenic variants and 3 large deletions, and 2 of them are novel. And now at our center, of course, that we take care of CF standards of care. Individual patient diagnosed with newborn screening or with positive family history for cystic fibrosis, of course that required efficient and accurate diagnostic confirmation. Swab test, of course, is a gold standard for diagnosis and is performed according to the European Cystic Fibrosis Society standards. Also, clear information about the disease and its management is improved, and genetic consulting is offered to the families. There are the standard treatment for patients with cystic fibrosis. As you can see, that everything is impossible for our patient. And I would like to say some words about the transition to the adult care. Years ago, we know that CF was disease connected to child condition, but today, with advanced treatment, with multidisciplinary approach, most of our patients live longer and longer. We are satisfied, we are happy with that. But process of a transition is very complex and should be graduated. And of course, that final decision on when to transfer to adult center at the end remains of the patient, because adolescent period is most vulnerable period. For someone, it's period from 16 to 21 years, for someone to 24 years, because it's not just growing, but also and mental development. Of course, that we have some difficulties and challenges. Modulator therapy is, during this year, we would like to be another step in our management. Of course, that we have patients which are non-eligible for the modulator therapy. CF-related diabetes, mellitus, CF-related hepatic disease, low compliance, adherence, severe lung disease, possibility for lung transplantation, and of course, cystic fibrosis-related metabolic syndrome and CF SPID definition and evaluation and management of them. And our last year, as I said, that was one of challenge for all of us. It was a twinning project acceptance. Mentis site is CF center, pediatric center in Skopje, and mentor site is Charité, Berlin. This is my last slide with pictures from the last year. I would like to say some words about last year. We ran for patients with cystic fibrosis to improve awareness for this disease. This year, April 13 will be the RISE for this year, and we will run together with patients with cystic fibrosis, because impossible become possible, and we hope that next year we will run with children with cystic fibrosis, because they will improve and provide with modulator therapy. Thank you very much.
What is the state of adult CF care in North Macedonia? Shortly. So there are approximately 62 CF adults over 18 years. The Adult CF Center reopened on 1st of March 2024, when the CF Center was reconstructed and renovated by Ministry of Health. At the moment, we take care of 35 adult CF patients, others waiting to be transferred. All CF patients from 12 years old who are eligible for ET are receiving it, so we succeeded. In adult CF center, 4 patients we are taking care, 4 patients are not eligible. So 2 of them are in very difficult condition. We have 2 CF mothers. One is the mother of 2, and she is not eligible for modulator therapy, and she's in bad condition, and she needs lung transplantation. One mother received modulator therapy while being pregnant, so we saw the child, we had done the eye exam, but it was without cataracta. We have 4 fathers, one have twins. So response to ETI. Before starting the modulator therapy, 6 CF patients had FEV1 beyond 40%. After 6 months, 3 still had FEV1 below 40%. 6 CF patients have slight response on sweat test. After 6 months, still above 80 millimole per liter, yet lung function in these patients is slightly better. One patient had 5 times upper liver enzyme, so it was discontinued for 2 weeks and carefully started again. One patient had liver cirrhosis and ascites, so it was discontinued, carefully started after 1 month. What are the gaps in our adult CF center? So in North Macedonia, there is no possibility for lung transplantation. We are not in Eurotransplant countries, so the process of lung transplant is very difficult. There is no possibility for detecting species for NTM. There is only one national laboratory for detecting TB and NTM, and there is no possibility for detecting species for Burkholderia. So that's it. Quick.
Yes, thank you. Thank you very much for quick and short on the time. Okay, now I will ask, we want? Okay, so we will do Montenegro. Okay, so now, come on. I would like to ask Professor Duška Tiešić-Drinković from Croatia CF Center. She will speak, I suppose, about both centers.
Yes, I will do the joint speak as we did.
We will do the joint speak, so also Andrea will come later.
I will do together because, as you know, we are, we said one center, and we function as one center. We work in 2 departments, the pediatric and the adult center, and this is the city of Zagreb where we come from and where is our national. Also, we must say that we are rather proud of that this year our center became the referral center of our Ministry of Health for both pediatric and adults. So it is not recognized only as a place where you can get treatment, but where you should be referred if there are any questions for anybody who is treated by somewhere else at that moment. This slide you already saw, and I'm not going to repeat. We are a small country, as you all know. And the number of our inhabitants is decreasing. The number of CF patients is not as high as we really have them, because we should have around 2 to 12 new patients expected per year, but actually the trend is that we see in real life 1 to 6 patients each year. So we think approximately that we have actually a double number of patients that it is now registered, because, as you know, we are not included in the screening program. I mean, newborn screening is not, for CF, is not included in our very good and very large newborn screening program, which is a national one, and this is one of our goals for the near future. To compare our situation with the European countries, with the rest in the registry, we have enrolled 151 patients in 2023, and 44% of our patients are adults now. We already know that Croatia is among the highest prevalence of Delta 508 with 99%. The median diagnosis age is 5.5 months. And we must say that, of course, it would be lower, most probably, if you had newborn screening. But I'm happy to say that in the last years, we do find some adult patients, which actually means that the awareness about CF among adult doctors has risen. So I find this as a step forward, although these 5.5 months is a little bit too high for my opinion and for the well-being of the patients. Regarding the bacterial load, we are there quite nicely, these percentages. We are this year, you see, below 10% for Pseudomonas, so that is nice in children. and I hope this is a step forward, certainly due to the modulators, but not only to the modulators, but for the all-over care of CF patients. To tell also something about the comparison regarding the lung function, so the blue line are the rest of the countries in the register, and the yellow line is our country. So we are somewhere near regarding the first slide, the FEV1, and below showing the nutritional status of our patients. Actually, we would like to be above this, and I hope that we will soon. How did we get there? That's a short history. So our first cases were described in 1970s approximately, and at that time we already had a good sweat testing possibility with the pilocarpine stimulation with an in-house method that actually lasted for a long time. Everything was quite available. Following the years we had of course more and more patients, and we from the beginning actually followed the standards of care which were published when they were published and according to the literature. However, we did not have a centralized care organized, but in some aspects we were even, let's say, ahead of the rest of the world. For example, we gave hypertonic saline earlier than most countries, presumably because we didn't have at that time pulmozyme, and it worked quite nice without pulmozyme, and it is cheap, so yeah, we liked that. The center was founded in 2017. At that point, we didn't have modulators, but very soon after the modulators, the triple combination was approved in Europe. It also came to our market. So altogether, we actually can say that the life of our patients has really improved over the years, which we see by the increase of the number of adult patients. And that is, of course, the site that you need to have a really dedicated adult service to make it work further on. So having an adult service and then having the CF center, we think that are the steps that really matter. For us, it was a long battle, and it usually is a long battle, always a long time battle. We started around the 2000 year. The pediatric team forced having an adult center. The first step was not so, it was practical, so we were able to treat patients even if they were adults within our department of pediatrics, but it is not, for a long standard, a good solution. You have to have really adult doctors treating the adult patients. A good and important step for us was that the first adult CF patient was transplanted in 2011, and that was actually the year and the occasion when, let's say, that the interest in CF among adult doctors also increased, and the adult CF team has been formed, and this has started, and was finally formed in 2015. And then in 2017, we formed formally a center with really a nice multidisciplinary team, because at that point we had 1/3 of our patients were adults, almost 40 patients, and as you know, you really need to have a number of patients to be able to be called a center. The center was composed according to the ECF standards with a very nice multidisciplinary team, which are both either the part of the pediatric center or the CF center, or the respiratory clinic of the adult part. And this is one of our first pictures. You already saw this, and we are rather proud of this from the beginning, quite a big number of different specialities. And of all of these people, you can say that they are CF doctors. Because of the number of patients, none of us can have only CF as the focus of their treatment, but a substantial part of time they are dedicated to CF patients and to CF education. That is also important. Of course, the number of patients with difficult complications rise, and therefore we have also our team which is spreading. And how do we work with the patients when it is always a teamwork? Both our clinics, the pediatric and the adult clinic, have 2 days dedicated especially for CF patients. We see them in separate rooms, not mixing either in between or with other patients. It is a really patient-centered, everything in 1 day time we organize. However, apart from these 2 days, our patients can contact us anytime, either by phone or by email or by texting, and we are there for them. And hospitalizations are held for IV treatment usually, in exacerbations or for complications. And I must say that the number of hospitalizations has really decreased nicely after the introduction of modulators. How we also plan the treatment of our patients, we see them regularly every 3 months, every patient, and the small children and infants more often. That means once a month, or at the time of the beginning of the diagnosis even more often. We always do anthropometry, we always do testing the lung function, and we always do microbiology, insist on that very much. And then annually we have the big reviews of our patients, with screening for diabetes after the age of 10, and for bone mineral disease also after the age of 10. And of course, if necessary, we'll do these exams more often. We have access to the low-dose CT, how we evaluate the lung imaging. And of course, we do not do that every year. These are our treatment options. First of all, the drugs which we give for symptomatic treatment. I didn't put in here mannitol, inhaled mannitol, that we do not have, and also I omitted azithromycin, which we do have and we do give regularly in this table. Everything what is here listed is funded is covered by our insurance, and that is nice. This, which has a little mark beside, that is either partly or totally funded by the patients. The situation is not so good with the devices. Devices, as you see, most of them are funded only by the patients, and this is one thing that we would really like to change a lot. And regarding the modulator treatment, so the modulators were introduced, as I said, by the end of 2021, both the double and the triple therapy, and every patient who is eligible is offered this treatment. Unfortunately, we have some age limitations now because the limit for the age limit has not dropped to the year of 2 for Kaftrio in our country, but we hope that it will happen soon. So these are some of our results. We have some people who refuse treatment with the pediatric ward and with the adult center. But actually, those who are not eligible, and they are not eligible because of the mutations, 4 of them in general, that is less than 2% of our patients altogether, are not eligible because of the mutations, and some because of the age. Where are we standing and what would we do in the future? What is in front of us? We have a lot of problems regarding the modulator therapy with adherence questions, medications, therapy, what to stop, how to stop. That's like that with the modulator treatment everywhere. We also have the problems not knowing how to evaluate microbiology because we have no sputum anymore in many patients. Yeah. And there are some new challenges regarding new epidemiology, new manifestations of CF, and some issues which will arise just because the patients are older, so they will get some other diseases like cancer diseases. We have to be able to treat that and find it in advance and so on. Newborn screening is certainly one of our first goals. And I think that next year we will be able to perform this, maybe with the cooperation with our Danish twin program, because they have the same mutation distribution, so we could copy it or at least take some advices from them really nicely. And we also hope to manage some scientific collaboration also with the Danish and the other ACRS. I think I will wrap it up with this. This is one picture of our team. And I thank them for everything that they do for our patients. I thank our patients, because without them, this would not mean anything. And thank you all for your attention.
Okay. Any questions, I think? No, I think in the interest of time. It's a pleasure to introduce a team from Montenegro, I think. Please excuse my Tomo Blamovic and Slatjana Radulovic. I hope that's fine. Because I visited Podgorica 1 year ago, and I think I was quite surprised how much you has achieved from what the topics has been discussed here. in a very silent way, in an isolated way, and it's interesting to see what you have achieved and how you achieved that.
Thank you. First of all, I would like to thank organizer for invitation, and also I would like to greet everyone because I didn't expect to be invited on the opening ceremony. I will present our experience in the treatment of patients in Montenegro. This will I skip. In Montenegro, we have 600,000 inhabitants, of which about 100,000 is children. We have 42 patients, 40 are Montenegrins and 2 is Russian citizens. Incidence in our country is 1 per 4,500. The most common mutation is F508 deletion. Most of our patients are homozygous with F508 deletion. 12 patients are heterozygous with 1 F508 deletion, and only 1 patient is not a carrier of the most common mutation, so therefore treatment is not possible. By the age, most of our patients are between 6 and 12 years of age. 11 patients are have less than 6 years age. Also, 11 patients are older than 18, and 5 patients are between 13 and 18 years of age. According to gender, the incidence is higher in boys. The majority of our patients, diagnosis is made at the age less than 6 months, 21. During the screening, in 3 patients, 2 newborn screening were done in Russia and 1 in our country. 3 patients were diagnosed at the age between 7 and 12 months. Also, 3 patients were diagnosed at the age between 1 and 2 years. And the same number is between 3 and 5 years, and 5 patients were older than 6 years. According to the regions, most of our patients live in the northern part of country. The incidence is 10 per 100,000 inhabitants, and the other part of country, southern and central part, the incidence is similar, about 5 per 100,000 inhabitants. Most of our patients live in Podgorica, and some are immigrants from the north part of country. A few words about treatment, CF treatment in Montenegro. Only 1 patient has no need for supplementation with pancreatic enzymes, CRAN, which is available in our country only in the form of capsule. Granules are purchased board, and patients get reimbursement from the government. And for low weight gain, we use hypercaloric diet, Nutri-Drink. For respiratory infections, we use oral intravenosus and inhalatory antibiotics, and for fungal infections, we use antimycotics. In this picture, we show the drugs that are available in our country. For eliminate mucus for airways, we use hypertonic saline with 3%, 7%, as well as the NAS alpha. This picture shows the frequency of use the NAS alpha in our patient. A few words about CFT and modulatory therapy in Montenegro. Molecular therapy CAF3 Calideco started in March 2023 for children who are older than 6 years. and in July 2024 for children who are older than 2 years. 32 patients use tablets, 5 patients are younger than 6 and use granules, 2 kids are younger than 2 years, and 1 patient does not have the mutation F508 and is not eligible for modulatory therapy. By age, 30 patients are older than 18, 10 patients are between 11 and 17 years, 9 patients are between 6 and 11, and 6 patients are between 2 and 5 years. In this picture, we show the positive effect after in lung function, body mass index, and drop in chloride in sweat after 1 and 2 years after taking after beginning of modulatory therapy. This diagram shows decrease in value in sweat chlor test after months, 6 months, 1 year, and 2 years after we started with modulatory therapy. Also, we show the increase in value in lung function after 1 month, 3 months, 6 months, 1 year, and 2 years. As we know, minimum CF center could be only a center could have 100 patients, whether children or adults. In special cases, a smaller number is acceptable, but nevertheless, than 50 patients. We have 42 patients, and annual checks are for patients who are older than 18 years old. We performed in the Institute for Mother and Child Disease Healthcare in Belgrade, and annual checks are for adults. We do not perform because we need to find a European center where we can send our patients. Newborn screening was implemented in March 2024, and the screening protocol has been developed. In last year, we done 6,141 RT analyses in 11 months period, and 3 tests were done in 20 children, and one were positive. So during this period, we diagnosed 1 child with CF. In conclusion, further plan is to monitor further effects of modulatory therapy, further implementation of new newborn screening, and introduction of new diagnosis procedures in our country, like fecal elastase, and to start do genetic test in our country. This is our patients after started taking modulatory therapy, which present for them a new, better life. That's it.
Yeah, thank you very much. Are there any questions, I think, in the audience? How does you achieve this access to the modulators? Was there a hard debate with the government, or was it more driven that other neighbor countries have access at that time?
It was a hard word. My colleague Slađana Radović.
Yeah. And do you need the patient organization for that? Because
yes, patient organization and healthcare provider through many actions with through the media, through the social networks, through the street actions in many cities in Montenegro, many famous persons in Montenegrin persons like actors and musicians and other singers, yes.
they asked for modulatory therapy, and we presented in Parliament of Government of Montenegro what is CF, what kind of diseases, and what is advantages of modulatory therapy. And we started modulatory therapy for all our patients.
That's great achievement, and the patients, I think...
every patients we made to use modulatory therapy.
Okay.
Yes, this covered with insurance. Every our patients have spirometry, nebulizers, and monthly they receive about 4,000 euros for some helps.
Okay. I think this is a very good example at the end of this session, I think, to give what can be achieved. I think you are close together, I think. You have different fights with your own government, but I think it gives also hope that it has been achieved, I think. That's a great achievement, I think, also with the newborn screening. And I think working closely together can hopefully solve some of the gaps and in knowledge, experience, and speeding up the process for the other countries. I think in this regard, I think we close a little bit later, but I think with a positive signal for the region, I think. Thank you very much, and see you tomorrow, and hope you have a good evening.